You go first.
Thank you, Chair. I move for the adoption of the agenda.
Thank you.
Thank you, Chair. Second.
Thank you. We then move to adopt the agenda as is. Babalwa, any apologies for today?
Good morning, Chair and members. I received the apologies from the following members: Honorable Kolabanat, Honorable Songwe, Honorable Moela, and Dr. Bushial will not be able to attend the meeting. She will be meeting with the evidence leader for the ad hoc committee. Honorable Skosana will join the meeting later, and Honorable Maitese. Just an apology.
But we have quorum to continue.
Yes, we do have a quorum to continue. We can start a meeting.
Thank you. So, colleagues, today we are going to start with the briefing from
Good morning, Honorable Chair. Good morning, Honorable Members, colleagues. My name is Vuisile Makalane. I'm the Acting Chief Director for Developmental Social Welfare Services under the Department of Social Development. Thank you.
Mornings, everybody. My name is Piwo Maseti. I'm Assistant Director for Accident and Emergency at CMH.
Okay, thank you very much, everyone. We have also been joined by the National Prosecuting Authority. Thank you very much for joining us. Before we start the program, I'm going to just give a little bit of a background as to what brings us here. So on the 22nd of July, the National Assembly, Parliament of the Republic of South Africa passed a motion asking several portfolio committees, the Portfolio Committee on Women, Youth and Persons with Disabilities, the Portfolio Committee of Health, Education, Justice, Police and Social Development to confer with one another and to come up with a public participation process to engage with stakeholders, various stakeholders, and to look into the crisis of child pregnancies and statutory rape. To that end, we have already at the weekend started in the city of Ekurhuleni. The city of Ekurhuleni has seen a rise in both teenage pregnancies and child pregnancies. We engaged with the various stakeholders from government, from civil society, the NPA and police. And we heard, for example, that there are several gaps in us protecting our children. For example, we heard about the lack of social workers. We heard of the lack of resources for NGOs. We heard of the lack of intergovernmental cooperation, and because of that, our children are falling through the cracks. We heard, for example, of secondary victimization when victims come forward either to clinics or police stations. They often face that secondary victimization. We've heard of families being complicit in statutory rape, in that they know that their children have been violated, but because there's a financial incentive either from a family member or from a perpetrator, these crimes go unreported. And then we also heard that there's generally a lack of implementation of the Children's Act, in that the Children's Act require all of us, neighbors, communities, nurses, teachers, social workers, to report cases of statutory rape. But for a variety of reasons, this is just not happening. And even when cases are reported, the conviction rates are very low. And so those are just some of the key takeaways that we got on those first round of our stakeholder engagements in the city of Johannesburg. We have been asked by Parliament to probe this issue. So we are on our first leg as various portfolio committees. This brings us to East London today, where we also want to listen, learn, and hear from you as to what you think is the extent of the crisis, what you think should be done to protect our children, and what you think Parliament should be taking back as recommendations. For example, one of the questions that we're asking is, tell us what you think is wrong and what should be fixed, in very simple terms, whether it's legislation that needs to be fixed. Is it that we need a national strategic plan on child
presentations, and there'll be 45 minutes for discussion. For now, would allow the CEO to welcome, to do welcomes and introduction.
Good morning, the Honorable Chair and the Honorable members, the head office members, our colleagues. Let me take this honor to welcome all the dignitaries that are here on this session. Thank you very much for choosing the Eastern Cape so that we engage on the crisis that we are having of the statutory rape that is happening in our country. You are welcome in this session. Thank you very much.
We will now have a word of welcome from the MEC.
Thank you very much. Good morning to you, chairpersons of this wonderful meeting, honorable members, NPA. Where's NPA? Where? Huh? They're still coming. I'm very cross with them today. I'm very cross with them. I'm going to deal with them. Officials Z2 from all departments, izandla neenyawo zalo rhulumente. We are nothing ngaphandle kwabo. Kodwa xa kusiliwa we are fighting. Chairperson, I'm a little bit annoyed this morning because of a failure of NPA and a failure of Nelson Mandela University management. A girl child committed suicide because she was raped by a student. NPA gave that boy child a bail. And university, because that has been given a bail, does not mean that is free. Uboniwe nje is not a flight risk, but criminal is still a criminal. But university didn't take that child as a criminal. Bambeke back university. The girl child now is passing by with the same perpetrator who have raped her. And that girl could not take it. She committed suicide. So that's why I'm saying I am cross. I'm arranging a meeting right now with Nelson Mandela University Management because they have failed that girl child. NPA have failed that girl child. I've already contacted the DP of NPA this morning. Why you keep on disappointing us? Rhodes was having the same problem of gang rape. Rhodes. Until sometime, girl children have to march naked. The university protected its image and name in that Rhodes University. They were opening, they had a kangaroo court in the university. There were no criminal cases opened. Until such time as Women's League of this province, who had to go there in that university. And we hammered Professor Mabuzeli, how dare you form a kangaroo court against our girl children? A girl child was brutally raped by a boy of 7. After graduation, he told me, Mama, I am not safe in South Africa. Ndimcile ndiphangele China. Reyitshwe namhlanje ngomso lo muntu abantu bakureyiphileyo ugilana nabo. We are leading as women in this government, but our people are exposed. Our girl children. You are afraid umntana xa siya university, a virgin. What you don't know, uzawuphela unyaka he says that virgin. So NPA, I'm very close with you. And I hope, Chairperson, you'll form part of this meeting that I'm arranging with Nelson Mandela. We must be, I was there last year. Another girl child was raped, but still that university is not taking serious the issue of rape in that university. And it means that we have got a serious problem in tertiary institutions. Even sometimes as leadership, siyahamba so campaign kweza universities. sibe ziinkokheli emini ebusuku sizowulala abantwana. Ndinga-political parties that I can mention them that are doing that. Babamithisa abantwana babagqiba babakhanyela. What leaders are we? What type of leaders are we? If emini sizinkokeli sizimember honorable members ebusuku were rapist. So that's why I'm annoyed today. A girl child, young one, beautiful, is no more because we have failed. The system, our systems have failed that girl child. Thank you.
I guess that's going to be a difficult one for us to deal with, but I guess it's good that the MEC has raised it so that we think about that. And I hope that will inform those that make presentations that this is what this is about. Your presentation should not be about tick boxes. We've come from 2 days where we're now recovering, almost dead from PowerPoint. That is sometimes meaningless to the topic. So I'm urging you to ensure that whatever you have to say to us, just bring it back to the relevance of what we hear about, the statutory rape of our young children. And I hope you look at us as people that can provide you with solutions. This should not be a complaining session. This should be a session about how we're going to help our young girls and not how we're going to complain about how under-resourced we are or how inefficient we are. Every department will have 15 minutes, and we will be starting with a presentation by the Department of Health. Your 15 minutes starts now. And as I told you, I come from the boxing world.
Once again, good morning, Honorable Chair. Good morning, honorable members. Let me just put it like this. Yeah. So basically, we'll be going through what the issues related to the Department of Health and other partners. Just as a background, we just want to indicate that we do have a challenge with sexual assault. That's how we are naming it in health. And that is posing a challenge when it comes to the risk of contracting HIV, especially around young women. And we also have to ensure that we attend to them before, after rape, that is the post-counseling that is required for those young girls. Now, in terms of we are also noting that there are challenges related to complying with failure to report sexual offense against children. I will then talk to that. There are legal provisions in terms of our Children's Act. It does protect our children to make some decisions. We do know that a child that is 12 years can consent to medical intervention. However, we do also know that a child under 18 years cannot consent to issues of sexual encounter. Now, we also want to indicate that although we are saying a child under 16 cannot legally consent to sexual issues, that is sexual contact with a partner, we are also going to report to you how we are in terms of the Tutuzela health centers. I might not dwell into them, but just to indicate that we do have Tutuzela centers that are working in partnership with NPA and Department of Social Development. And what I will talk to is that as health, we provide services and equipment for the Tutuzela centers, as well as the resources in terms of the medical practitioners and our professional nurses trained on clinical forensic. Yes, yes. Please help me. Okay, so just help me with the technology. Mm. Please figure it out. What? consistently doing. And we also provide debriefing sessions for our clinicians who work in these centers. Remember, they have also got to provide counseling pre and post for the assault cases. And this is what we are just indicating in terms of the equipment and the allocation within the district health programs grant, an allocation of 7 million that we have set aside to ensure that these facilities, they function. Now, in terms of monitoring, we are saying as a Department of Health, we do acknowledge the weaknesses in our system, and we have actually embarked in ensuring that we do continuous in-service education for our professionals by reminding them that a child or a pregnant girl who is under 16 cannot be managed in our clinics because that is a high-risk client. So therefore, if that child presents himself or herself in our PHC facilities, one, you identify that one as a high risk. Secondly, according to law, we should be reporting to police. However, you will find that in our situation, because these are children that are not even ready physically and emotionally to be pregnant, some of them were not even aware that they are pregnant. By the time they present themselves to our facilities, most of them are almost at term. They don't present any like normal pregnancies for adults. They will come and they will be at 8 months, and when they come, you find that already they come with complications. For example, they would come with proteinuria, they will come with high blood pressure, they will come with... So what normally clinicians would do would focus on the clinical management, fill in the form 22, refer to the social workers for further investigation. That's why I'm saying this is a gap that we have identified as health, and we are currently developing an SOP on how we can streamline the reporting, knowing exactly that. To be practical and honest, if you go to a clinic, you find that there might not be adequate staff to leave patients and go and report. Then the SOP will then clarify in terms of how we can do that. Now, we are also focusing on the interventions that can reduce unwanted pregnancy among our youth. One of which, working with the cultural groups like Untitled, because Untitled would actually encourage a behavior change. Any child, young girl must say no. However, as health, when we partner with Untitled, we do acknowledge the behavior change, but we also say in cases where you are no longer a virgin, these are the options that we have. We provide prevention and combination prevention in terms of using a condom, in terms of accessing family planning services. As I indicated earlier on, a 12-year child can decide to start family planning. And one of the issues that we've looked at is we identify a gap within our system that says when a young girl comes to a clinic and sees me of my age, they become intimidated. Hence, the National Department of Health introduced a policy on youth zones, which are meant by young professionals. And there's training that is done for professionals working there. Those youth zones, you'll find that children, they feel it is a safe space where they can interact freely. A 13-year-old can say, I want to terminate pregnancy. And the staff, they are prepared in terms of pre-abortion counseling and post-abortion counseling. I must also indicate, they might not all be fully functional. We've got 534, because once the nurse resigns, or the nurse left young ones, because they are not managed by nurses of my age, you find that you still have to restart the process. So, and there's also an app that has been provided, the BeWise app, where they can, if they encounter an attitude, they can log onto the app and report immediately. Those are some of the interventions that we are looking at. Now, here we just want to show you, in terms of these pre-exposure sexual assault cases. With us, we're just looking at the time when we started reporting these cases. We started reporting these cases in 2020, 2021 financial year. Now, if you look at this slide, it just shows you how many of the new sexual offences are seen in our facilities? Then the line, the bar in blue, and then how many of those that test negative? And then how many of them that we give prophylaxis? Now you can see that if you look at the graph, in terms of the negative, what I can indicate is that we do understand when you have been raped, for you to also be cancelled and be told that you are positive now. Most of them, they refuse to be tested. But others, you find that they are already on act. But others will indicate will come. But what we are appreciating, although we are noting the decline in terms of the numbers of those that were given prophylaxis, it is a challenge that we need to look at. And I think what we're discussing with my team is that we should have a system of following up each and every sexual assault case, so that we can be very much sure that in terms of the clinical and continued support for this particular individual that is existing. So it's another weakness which we are working on, and we felt, oh, my battery is getting off now for my laptop. Yeah, I've got a charger there. Okay, I can continue, thank you. And then in terms of deliveries, we're also using a proxy indicator to measure teenage pregnancy. That is how many of our young girls, they fall pregnant between ages 10 and 14. What we do, we look at the total number of deliveries for a particular period. And we then say, what proportion of that will belong to 10 to 14 years? We've just used the numbers. And you can see, if you look at this, if you look at the deliveries 10 to 14, if you look at deliveries, if you look at the slide, you can see that the slide is showing a downward trajectory. And we are not excited about it. We are grateful that with the interventions that we're implementing, at least we can see that there is the numbers are getting lesser. However, even if it's one, if it is a 10 to 14-year-old, it is not really acceptable, and it remains a challenge. Now, for maternal mortality, we also wanted to reflect this. The relationship between the previous slide and this one is that I indicated that these children, when they are pregnant, they are still teenagers. And because they are teenagers, they then experience medical complications. They report late, and when they report late, they present with signs of hypertension, and some of them, they develop preeclampsia. And when we do an analysis of our maternal deaths, we found that the children, those teenagers are ranging on that age group, they also are the ones that are dying, are demising. And we have also observed recently a trend where we've got teenagers that are dying, committing suicide around Alfredo. Between the period that we've reported from April to September, we had 3 deaths from teenagers. 2 in Bizana, 1 in in Matatiela. So that is quite concerning, because Baikama is a tank. I've spoken about the primary causes of maternal deaths, which is hypertension, obviously. It's related to the numbers, the ages of the children. What have we done? We have actually been training our staff on Funda Friday, just to ensure that there's continuous learning, because to be honest, as clinicians, this issue of us going to courts and testifying and reporting, it's quite challenging. And hence we've got that man, Mr. Mbangeli, to always talk to us, and we need a paradigm shift, because even when cases are reported, clinicians sometimes, because they are not expertise in the field, they don't feel comfortable to go and testify. And hence these Funda Fridays, every Friday, we present cases, we engage, we discuss. Cases that we discuss are related to the near misses. Near miss is someone who was about to die and an intervention was implemented and was saved. So usually it's our young people that would come with complications, and we then engage in terms of what happens from the first day he or she appears in our clinic. And that is what we are doing. And the issue of the SOP for reporting and referral, that is what we are doing as well. And I alluded to the fact that we are not reporting on time, but we do know that there are sporadic facilities like the doctor in Queenstown that reported a rape case, if it was also in the media. So there are health professionals already. So there's generally a shift. What becomes critical before I land, because I've got a team that is here, is that when it comes to contraception, remember, we're talking 10 to 14 years. How do you offer an IUCD, intrauterine contraceptive, in loop for a child who's 10? How do you even start talking about all these methods of family planning, of which we do believe that as parents, as families, all this should also start at home. By not saying my child is still young, but you must be able to say, if you feel there's something that is happening with you, please report, talk to me, so that we can be able to assist the parents, even the child, to terminate that pregnancy. Okay, Doc. No, thank you very much. I'm sorry for the glitches. I'm so sorry. Thank you. I must just end here.
Let the record show that we gave you 5 minutes extra because of the wardrobe malfunction. We will take all the presentations before we go into discussion. So I would now give the opportunity to the Department of Social Development.
basically going to take you through the presentation by Social Development on how the department is dealing and providing support to statutory rape. That's the outline. Slide shows and see. That's basically the outline in terms of what I'll be talking about, focusing on those bullets, the scale of the problem in the province. We have also provided disaggregated data per district, the services that we render as the Department of Social Development. You can go to the next slide. Those are all the issues that we'll be presenting to this portfolio committee and the challenges and the key recommendations that we have made. And that's basically the key purpose in terms of today's session, to give an overview of services that we render as the Department of Social Development in responding to cases of statutory rape. This presentation will cover the scale of the problem in the province, the disaggregated data, and in terms of reported cases per district. We will also provide policy and law reform, including service delivery improvement areas. You can go to the next slide and see them. Those are the key pieces of legislation that inform the mandate of the department. I am not going to bore you with that, but they are as listed there. You can go to the next slide and see them. And that's basically the mandate of the Department of Social Development. And we are saying that we've got an obligation and the mandate to ensure care and protection of children from abuse, neglect, exploitation, degradation of all forms of violence. That's the key mandate of the Department of Social Development. You can go to the next slide, Cecilia. The scale of the problem in the province. That's basically what we are saying as the department, that we are the fourth province with the highest proportion of reported cases of sexual abuse and statutory rape, with Nelson Mandela Metro, the highest, followed by O.R. Tambo, Alfred Nzo, and Christian. That total, Mr. Tafen, go back to the previous slide, that total 1,118 cases of sexual abuse in the province of the Eastern Cape were reported during that financial year. You can go to the next slide. And these are the cases of sexual abuse and sexual assault per district. As you can see the numbers as listed, that Nelson Mandela is the highest with 369 cases. And the total is that 1,118. Don't do that. You can go to the next slide. We have disaggregated the data in terms of this slide, in terms of age and gender. In Nelson Mandela, this is the stats that we have as the Department of Social Development. In terms of Nelson Mandela, we are saying we've got 369 cases, and of those cases, 309 are females. In that fashion, as you can see, that O.R. Tambo follows after Nelson Mandela with 332, and 18 of those cases are males. So it affects both ways, males and females. It's statutory rape in this province. You can go to the next slide. Not go to bore with you with that. We have got the presentation. And then in terms of this, this is a disaggregated data per district per month, and this starts from the last financial year, 2024-25, and the current financial year, 2025-26. This is April, May, June, July, August, September, October, November, December, 2024-25 financial year, and the rest is the stats in terms of the current financial year. You can go to the next slide. These are the services that we render as the Department of Social Development. Parent and caregiver support, which becomes very critical. Building capacity of parents and caregivers through parenting programs, and ensure that the home environment is safe for children, reducing incidences of child abuse, neglect and exploitation, stop the use of corporal and physical punishment of children. We prevent and intervene early. We provide those services. Raising awareness on child abuse, including safety in the use of social media. Advocacy programs, we render those programs promoting child participation on children's rights. Response care, support and healing, we provide, and that becomes critical in terms of the Department of Social Development. The provision of psychosocial support, trauma counseling, raising awareness about available services in the department. Social behavior change program, we instill positive norms and values, working with traditional and whole of government, whole of society approach. That is what we have adopted as the Department of Social Development, because we can never do that alone as a department. You can go to the next slide. Still on the services that we render, we have the responsibility to ensure early identification of orphaned, inkedama, and vulnerable children, adolescents and youth at highest risk of HIV through risk assessments that we do as the department. The implementation of HIV testing services we provide is within the legal framework and is guided by the professional values and principles. And we are not doing that alone. We work closely with the Department of Health in that regard. Ongoing support services we provide designed to ensure that those that are HIV positive access the antiretrovirals. You can go to the next slide. Those are still the services that we provide, working together with the various government departments in the province, the victim support services, the White House Centers of Hope. We provide that service. Provision of sheltering services, I've already spoken to that, and residential care for child victims. Training of social services practitioners on victim empowerment and sexual offenses. We provide those services as well. You can go to, and then go straight to the referrals. We've got an effective referral network in terms of HTS, which is utilized and maintained with the Department of Health, Tutuzela centers and South African Police Services. And some of those centers, you will find them in police stations where we shelter our victims. And then key issues and concerns, and we will also reflect on the best practices. Are there any best practices that we have since experienced as the province? Intersectoral collaboration, I've already spoken to that we can never do it alone. Health can never do it alone. The Department of Justice can never do it alone. The NPA and all of us colleagues, we must work integratedly, collaboratively to deal with this sketch, because it has now become a sketch. Trained professionals, health practitioners, social workers have been adequately trained on the Children's Act. Community awareness, I've already spoken to that we raise awareness through awareness campaigns, working together with communities. You can go to the next slide. Go to the previous one. Oh yes, and supportive supervision, regular supervision and feedback to assist, in the practitioners feel confident about the work that they do. And then going straight to the next slide, what impedes mandatory reporting? Lack of knowledge. Department of Health or the chairperson spoke to that. Lack of knowledge. Many professionals are unsure of what constitutes reportable abuse, or the correct process for completing Form 22. There are various forms as a fiduciary in that regard, but there is lack of knowledge even in terms of filling those forms. However, the department continues to capacitate mandated persons, high workload and under-resourcing. Social service professionals are often overburdened with statutory services and lack time to dedicate towards prevention and early intervention services. And probably let me pause on this one, because as the department, in fact as a province, we've got dire shortage of, looking at your direction, Chairperson, we've got dire shortages of social workers to provide these services to assist our victims. That is one of the key challenges confronting the Department of Social Development. Shortage of social workers. You can go to the next slide and see it. This is why reporting is not happening. That and those were mentioned by the chairperson of this portfolio committee. Fear of attack by communities. Fear of stigmatization. In a stigma. Who's born in umzondo, because you are a victim of sexual assault. Lack of information, I've already spoken to that, and financial dependence ufumanise uba the perpetrator is a breadwinner. Families may avoid reporting to preserve financial stability within the family. That's one of the key challenges that are facing. Reasons why reporting is not happening: continued inadequate supervision and accountability mechanisms. And I've already spoken to that. That because of the shortage of social workers, we are not able to efficiently and effectively support these victims. Systemic barriers, delays in investigation due to non-availability of tools of trade. Sometimes no tools of trade, vehicles and supervisors. And in that regard, I am talking about social work supervisors. Lack of confidentiality, there is no confidentiality, or weak referral pathways. 2 minutes. Thank you very much, Eke. Emotional fatigue or burnout among social workers and frontline. Those are the challenges that we decided to reflect on. Under-reporting, as I've already indicated, limited specialized sectors, capacity constraints I've indicated. In terms of that there are no social workers, delayed legal processes, and the issue of the cultural norms. Those are the recommendations, honorable members. We are saying in terms of policy and law reform, we must strengthen enforcement of mandatory reporting provisions within the Children's Act, Act number 38 of 2005, integrate reporting into performance monitoring systems, and then in terms of service delivery, utilization of standard operating procedures, SOPs, improve feedback mechanisms between departments, all those departments that are affected, and those that have a role to play in terms of that. Training and capacity building, we must continue providing capacity and the resources. I've already spoken to that. There are limited resources. Recommendations continued. The fiscal is shrinking. Strengthening community awareness. We must do more with less. Strengthening legal frameworks. Expand provision of care and support services. Training of key role players. Go straight to the next line. And then in conclusion, we are saying thank you very much. That was my last slide. Thank
you very much. Thank you for the presentation. The next presentation will be from the Department of Education. Just to remind the presenters that it is not compulsory for you to read all your slides. Especially those that have been sent out before. We've read them, just take out the key points from each slide. Department of Education. Abeg. Okay. Is child welfare here? Okay. The floor is yours for your presentation.
All protocol observed. Let me firstly apologize. I did not prepare slideshows or PowerPoint presentation. Yes, I hope I am forgiven, Madam MEC. Sitting in front of you is Zinhle. I am a social worker and an office manager from Child Welfare South Africa in King Williamstown. I am sorry, I got an invite to do a presentation. Firstly, I'm going to give an overview of child welfare. Child Welfare South Africa has been in operation since 1917. Then it was known as Child and Family District Welfare. However, it has evolved over the years. It is now known as Child Welfare South Africa, King Williamstown. We are based at number 6 Edward Street. We are 3 social workers, including the office manager, and 3 social auxiliary workers. We are working on statutory cases and PIP, which is known as Prevention and Early Intervention Programs. We have 6 programs that we facilitate, which is capacity building, training of community volunteers, parenting skills, foster children, and foster parents programs. We also provide psychosocial supports around EPCMM. We are working with 17 areas in King Williamstown. We are working with children from ages 0 to 11. We are subsidized by the Department of Social Development currently. Our vision is to promote, protect, and enhance safety and well-being and healthy development of children. There are various stakeholders that we are working with, to name few: Tutuzela, Bishop Hospital, Ray Hospital, Zwelicha, and King Williamstown Magistrate Court. We are also working with various child and youth care centers, which is Good Samaritan, East London, CYCC, Daily Bread, Open Arms, Guardians of Hope, and Green Sleeves. For the past 5 years, because I'm here to talk about statutory rape, for the past 5 years, we have had about 5 cases that were reported on statutory rape. However, in those 5 cases, 3 were girls and 2 were boys in those cases. The cases that were reported, the problem that we encounter with statutory cases is that they get reported late according to the Department of Police, and there is no substantial evidence that proves that an act was done. We do take children to Tutuzela for assessment, and when the children are there, they are shown that there was an assault that was conducted. However, there is no evidence, because maybe it is reported 3 months or 5 months, so there is no evidence that can put the perpetrator behind bars. That is the problem that we are having. Also, the lack of cooperation from the communities and parents. Parents refuse to report such cases. They prefer to talk about the cases within their family groups, within their communities. That is how they resolve those cases. Also, in working with overseas, the orphan and vulnerable children, we also experience challenges that when we report child neglect cases to our fellow stakeholders, the police, it doesn't go any further. The cases usually disappear, or the cases can't be taken to court because there is no evidence, and that is enough to put the perpetrator behind bars. And our perpetrators are still roaming around the streets. Teachers also fear to report those cases because they fear the retaliation from the families and the communities. They feel that they are not protected as well. The concerns the key concerns, the trained professionals, supportive supervision. We do have trained professionals working in those cases that are social workers and social auxiliary workers that are working tirelessly to safeguard our children. And we also do supportive supervision, which includes regular monitoring through home visits and aftercare services, whereby if a child is being abused or the child is neglected, we do the process of removal. After we remove the child, we find a placement, a temporary placement of the child. We place the child in CYCC, or we place the child in safety homes or with safety parents. The problems that we encounter throughout our rendering those services is that, for one, we are understaffed. There are a lot of social workers that are unemployed, and the employed social workers are very few, and there is a workload of those cases. Underpayments. As the NPO sector, we are very much underpaid. It makes it difficult for our staff members to do their work diligently and to do their work tirelessly because they are underpaid. Lack of cooperation from communities. As the organizations, we do encounter lack of cooperation from our fellow communities. Members of the communities are refusing to participate because they don't want to be called sellouts. They fear for their lives because they are not protected. And a lack of information. As much as there are trainings and awareness campaigns that are provided, however, those trainings are sometimes attended by supervisors or managers, and the people on the ground are not attending those services or those trainings. To make an example of what I'm saying, there is a huge problem that we encounter. I am sorry to the SAPS department over Icona App. However, we have a huge problem. When we go to report those cases in police, you are firstly asked, who are you? In what capacity are you reporting this matter? What crime has this person committed, especially with child abuse? Child abuse is not taken as a serious crime in our country. Child abandonment is not taken as a serious crime. So it is disheartening, and it causes us to not to be motivated to report as official those cases in the police, because when we remove a child because of child neglect, we are ought to sign. There was a mentioning of Form 22. That Form 22 needs to be signed and submitted to the Department of Social Development, and there is a Form 23 that needs to be signed as well, but we can't proceed to Form 22, to Form 23 if Form 22, the perpetrator is not apprehended, or on Form 22, it is not complete. So that is why you will see in the presentations as a result, there are few cases as if now, because that Form 23 needs to be completed. Yes, I think I am done with my presentation. Thank you very much.
I guess it may be to our advantage if all the others lose their presentations. They will keep to time. We now have a presentation from a group called CMR.
Maybe before that group starts, is if it's possible to move the podium to a little bit to that side, because the other group, they are unable to see the board. If it's possible, we'll request that for 2 seconds.
And I guess they will explain what CMR stands for.
Greetings to the Chair, the Honorable MEC, I'm sorry about that, honorable members and colleagues. My name is Nkitangoho. I'm a social worker working at CMR. I'm here with Mr. Senaomananga. We are here representing, or on behalf of our office manager and supervisor, Ms. Sylvia Gyunase. She was hospitalized. Then she asked us to come and represent her. I would like to apologize. Due to that, we didn't prepare anything. So that's why you don't have any slides from CMR. But we are going to give just a brief presentation of the services that we render from our organization. Okay, CMR is an abbreviation for an Afrikaans name. It's Christelijk Maatschappelijke Raad. Thank you very much for that. Well, CMR is that, and we are a child protection organization that is based in Southern Road in East London, number 9 Gordon Road. We provide services to children that are in need of care protection, ensuring that they are protected against abuse, neglect, abandonment, and all other needs that they may have. So from our side, when we do get, I hear that here we're talking about statutory rape. When a case of child abuse, or let me say statutory rape, is reported to us, we as the social workers from CMR, we would investigate that, but implement emergency action of removing that child from that place that was unsafe for that child. We remove that child from that home and place the child at a safety home, or with safety parents that we have screened as CMR, while we then continue with investigations of the alleged abuse. While we also do that, we then refer that child for all the necessary services that may be of need to the child. We do take a child to Untitled Care Center, which is here at Cecilia Makiwane Hospital. And it's fortunate for us there because there is also an office of the SAPS, whereby then when the child visits Untitled Care Center, they're even able to open that case there on the same day. They don't have to go to SAPS, they do everything there. And then the case will be then transferred to FCS unit within SAPS, who is then going to investigate the matter further. At CMR, we also do what is called prevention and early intervention programs, whereby we go to schools, because that's where we get most of our clients, which is children. We get them at schools. So we normally do awareness campaigns on protective behaviors, also trying to highlight this thing of statutory rape. Even though we do those awareness campaigns, there is some changes in reporting this kind of abuse, but we're still working on that. We're hoping that the more we do these campaigns, the more the people are going to come out and state what is happening in their communities. At CMR, we work in 5 areas within East London. We work at Reston area, we work at Duncan Village area, we work at Darkheads area, we work at Mzamomhle area, and some parts of East London city suburb areas, where we work with children from 0 to 18 years of age. Some of the challenges that we have, I think my fellow colleague here has stated some of them. The issue of the referral system. We do encounter problems whereby maybe a school teacher or a school counselor is reporting a matter to us, and they are not aware that they're supposed to fill in a Form 22, which is they're reporting that abuse to the Department of Social Development. Even with the police, some cases would be directly reported to them, instead of them doing the Form 36, which is authorizing the removal of a child from the place where the incident happened, from the home where the incident happened, and taking them to a safety place. They would tend to tell clients that they should come to CMR to report the matter, whereas even SAPS is mandated to remove a child and place a child at a safety place and then report the matter to the child protection organization so that we investigate the matter further. So there is that slight problem with that referral system, and also collaboration with the Department of Justice, because we would do these removals, and when we have to place those children at the CYCCs, some CYCCs do not want to accept those children because they come to them without a court order, and that is not legal. So we will be delayed by the Department of Justice in getting those court orders that state that the child can be placed at that CYCC. Another challenge that we have is the shortage of safety homes or safety parents. But at CMR, we are process of trying to recruit and market so that we get individuals and families that are interested in taking care of children. We do go to local radio stations. I think 2 weeks ago we were at Link FM. We tried to even post on our Facebook page. We market ourselves so that we get families that are interested in taking care of children and protecting them. Another challenge is the caseload. We know that a social worker is supposed to have 60 cases, but now as Nkita, I have 108 at the moment. I don't know about Mr. Managa, so we are overwhelmed with cases. So that is a challenge as well. And in the shortage of social workers. We are only 14 social workers in one of the recommendations that we have is that there is this training or capacity building whereby stakeholders are capacitated on the referral system. What must be done when there's this case reported? How do we work together, especially maybe in the Eastern area or in the PCM area? How do we work together? If I have to go to Zela Care Center, how do I quickly get attended on what I'm coming with? When I go to the police station, what could be quickly be done so that I don't sit at the police station because service delivery is waiting for me at the office while I'm sitting at the police station trying to get assisted. From our side, I think that's all. Thank you very much.
Thank you for keeping up with time. We now move on. Our next presentation is by Makiwane Women's Rights International. I hope they are here, they are ready. It's them here. Thank you. Your time starts now.
that over the Christmas period, that is when our stats are extremely high for rape in the TCCs, the two TCCs. And then, of course, we have external funders which pay for all of this. And I must say that we were adversely affected by the withdrawal of USAID funding, because the TCCs were funded by USAID, as well as some of the implementation programs. I'm not going to go through this. You do have this, but I gave you the link as to how we actually align our programming to the NSP on gender-based violence and femicide, so that with each of the pillars, Masimanyane's work actually aligns very closely. To come to the issue of child and teenage pregnancy, and honorable members, I want to say child and teenage pregnancy. Because when we use teenage pregnancy, there's a misnomer that they are all teenagers. And the Department of Health knows, and we all know in the room, that some of our statistics, our children are even younger than 10. Now, I thought I'd share with you, this is the Department of Health's data. I don't want to claim the data. But in your packs, you will see that you have, from the time January to September 2025, we've had 18 deliveries of young people between the ages of 10 to 14 in the months. These are the months of January, March, the period, the quarter, January to March, 18 deliveries in that age group, 10 to 14. When you come to April to June, we have 10 to 14 years who gave birth. And when you come to the age, to the period, July to September, we have 13 who gave birth. Now, when you come to terminations, and I'm going to break it down to you in a chart so that you can see that clearly, because this is extremely concerning. In Buffalo City, deliveries 10 to 14 years in the facility were 45 for January to September. Delivery 15 to 19 years in BCM was 1,152 young people. So the total was 1,197 honorable members. Then if you look at terminations of pregnancy, 10 to 14 years, we had 17 terminations of pregnancies. We're talking about these that are legal terminations. We're not talking about all the other illegal terminations that are happening, because the more we conduct awareness and remove the posters from the polls, the very next day those posters are back on the polls for all the illegal terminations. And we know that a young person giving birth, the dangers that that body encounters, because at the end of the day, the body is not ready. So imagine aborting. She could possibly die. So terminations 15 to 19, there were 257. This is this year alone, eh? We're not even at the end of the year. So we've had a total of 274 terminations in BCM, and these are the ones done at the hospitals. So, and this is in BCM. So we're talking Freya Hospital, we're talking CMH, we're talking Grey. And what concerns me every time we look at the stats, Grey has no. It's always 0. And I find that very strange, because we are running the 2 TCCs. And I can tell you that most of our statistics for rape, half of them are children in the TCCs. So I've just given you a comparison with ADM, not that I'm saying ADM is doing better, because no child should be pregnant. So what are the key issues and concerns that we are seeing from an NGO perspective? The high number of young, very young pregnancies, 10 to 14, signals both sexual activity with under consent age girls and possibly statutory rape and exploitation. And I want to remind us, just last week, we had a case that was here in East London where there was someone who was in a school, allegedly a deputy principal, who was trafficking young people from rural areas to East London. Now, I'm going to say this, and I can say this with all conviction. Had the NGOs not been at the court protesting that day, the NPA was prepared to give bail to that perpetrator. And we stood our ground, and you know the end result. So the NGO sector plays a very vital role in what we are doing. What I want to quickly say, because I saw 2 minutes, there is silencing of children by their parents or guardians. Strong community pressures and stigma, children fear retaliation, families may prefer not to involve the police. 89% of perpetrators are known to survivors. Sometimes it's within their own homes, it's their uncles, it's their malume, it's somebody they know that has raped them. There's secondary victimization. Then we want to also alert the honorable members to the geographic and transport access constraints. Children and families living in outlying wards may not be able to, they may have difficulty accessing social services or police stations to report or follow up. In the rural-urban mixed context like BCM, teachers and nurses may not have adequate training, and I alluded to training problems earlier. Community members and educators may lack confidence in the system because even if they do report, they receive no feedback. And in the health context, when a 12-year-old, and the Department of Health said this, when a 12-year-old is pregnant and gives birth, the focus is on the pregnancy care and not to immediate criminal reporting or investigation. So policy reforms in terms of our recommendations, we are saying that we should ensure that the municipal and provincial policy mandates for reporting are clearly communicated to all schools and clinics in BCM. We are suggesting a memorandum of understanding. And then service delivery in each clinic or health facility must establish a first response child sex abuse, statutory rape protocol. Each school must establish a safe reporting system. There must be a building of peer support networks in BCM and government awareness to fund organizations that are running community awareness in BCM about the age of legal consent, risks of adult-child relationships, how to report and where to go. I have also circulated some of our information for the honorable members to have a look at. It's with your secretariat. Thank you.
Thank you. Thank you for your presentation. We want to welcome the MEC for Basic Education. I believe he is in our midst, but we will allow him time later. For now, we want to take the next presentation, and please try to be on the high level so as we don't cut you, give us the important things. The next presentation that we'll take is Childline. You can take the stage. Thank you. Are they here? Oh, thank you.
Good morning. Is it still morning? Oh, good morning, everyone. I do have a slide, a PowerPoint presentation. I am not sure if someone can assist me with that, connecting.
Minutes is gone.
I'll be very quick. Greetings to the MECs and everyone in the room. Standing before you is Okuhle Mdodana from Childline Director, Childline Eastern Cape. I'll just provide a brief overview of what we are as an organization and what we stand for. I will not bore you with the backgrounds and everything else. Childline Eastern Cape is a child protection organization that advocates against violation of children's rights. Our vision as Childline is to work collectively to promote or protect children from all forms of violence and create a culture of children in Eastern Cape. Our mission is to provide a range of services, which is prevention and response to violence against children, including offering a 24-hour toll-free helpline and therapeutic services for victims and their families. The organization also focuses on rendering educational programs in schools, which is your teenage mothers programs, parenting enrichment programs. We have identified that as an organization that there's a huge gap in terms of parenting in the 21st century. If you would go back, parenting now is very different amongst parents, and they do not understand what the Children's Act stands for and why was it created in the first place. They would also highlight that children are given more rights as opposed to humans' rights. And we will always educate them and empower them that children's right is not not very far from your human's rights. We all have rights, and those rights need to be protected. The reason why the children's right was formulated is because children are vulnerable, and also older people are vulnerable as well. So it's our role to educate them. And we've got a footprint in the entire South Africa, whereby we Childline is a national. Sorry, I'm stuttering. Childline is a national organization. So in all provinces, we have Childline. So we form part of the Childline South Africa, whereby we are an independent affiliate of the Childline South Africa network. The reason why we're here is for us to talk about statutory rape, and I'll be very brief. We'll talk about the realities of statutory rape in the South African context, where despite the legal protection against sexual exploitations of minors, statutory rape remains a significant issue in South Africa. Many cases go unreported due to lack of fear, shame, or lack of trust in the justice system. Statutory rape involves adult men and minor children, minor girls. However, the reverse scenarios also occur. There are difficulties in investigation or prosecution of statutory rape cases, as it needs a collaboration of evidence, which make it difficult to secure convictions. There is a contradiction when it comes to termination of pregnancies and the legal age of consent for children in South Africa. While the law permits minor children between the ages of 12 to 16 to access abortion services without parental consent, under the Choice of Termination of Pregnancies Act 1996. The legal age of consent for sexual activity remains 16 years. This creates a complex situation where minors may seek safe abortion services despite their classification as beyond the age of sexual consent. Rising concerns about potential exploitation and abuse also highlights an issue of autonomy, and reproduction rights of young girls who are capable of making decisions about their reproductive health. The contradiction complicates the legal, ethical, and health policies, often resulting in a gap in protection, enforcement, and support for vulnerable children and adolescents. Addressing this inconsistency is crucial to ensure that minors' reproductive rights are protected while safeguarding them from exploitation. What can we do as a collective to ensure that we provide prevention strategies? It's providing specialized training for police, prosecutors, and judiciary on handling sexual offenses and supporting victims. Implement age-appropriate cultural sensitivity sexual education in schools to inform young girls about their rights and concerns and risk. Engage traditional leaders, religious leaders, and local adults to promote attitudes that condemn statutory rape and protect minors. Establish clinics that can provide confidential, health-friendly, protective health services, including contraception and counseling. Provide economic opportunities like skills development training and social support to reduce the vulnerability of provide economic opportunities like life skills training and social support to reduce vulnerability to exploitation. Collect and analyze data on cases of statutory rape to identify hotspots that target interventions effectively. Who is responsible to ensure that we minimize statutory rape? It's parents, as they are the primary caregivers, role players in the government sector, NGO sector, business, and media. So we are all responsible in ensuring that children are not exploited or are not exploited or violated. What do we do as an organization to ensure that we minimize the risks or statutory rape in the province? We provide education and awareness programs like sharing information about the services that we are rendering, also providing and empowering the children in communities about the legal processes and what they can expect so that they can make informed decisions about actions that can assist them. So we carefully listen to the survivors as a way of providing emotional support at a time where he or she is trying to make sense of what they are feeling as consequences to trauma suffering. We assist a survivor in accessing medical attention, getting a shower, finding clothes to wear, obtaining a protection order against the perpetrator, arranging transportation to safe places and shelters. As I've mentioned before, we do have a 24-hour helpline which functions 24 hours, 7 days a week. So Childline's helpline functions as both as a prevention and early intervention service, which is offering a service they can contact for counseling, information, and guidance before a situation develops to a stage where statutory rape or tertiary interventions are required. It also established communities as far from service providers access to the child protection system services. As we all know that we do have communities in the Eastern Cape as it is a rural province where other people would travel very far. So distance and proximity is a problem. So Childline is there when one can be stationed in a deep rural area and still is able to access the service that Childline offers,
Let's
which is
wrap up.
which is a helpline.
Ngikuzamile sis, awuzameki.
Yeah, I'm done. Thank you.
Okay, no. Okay, thank you. I was giving you 2 seconds to wrap up. Are you done?
Yes, yes, I'm done.
Okay, thank you so much. Give her a round of applause again. Thank you so much. Ndiva bathi u-MEC waka-education ufundile, uncwadile. So awungamind lo mlungu ola eceleni kwami uyandiva ukuba ngithini. Honorable Minister, we'll give you, I think 5 minutes will be enough ukuthi usibingelele ngoba sifuna kwazi ukuthi why department yakho ingekho kuzo present. Silapha because le issue lesihleli ngayo la ibaluleke kakhulu. Kodwa asisho ukuthi siba disappointed ukuthi the very important department edilishana nabantwana la kubonakala khona kakhulu lenkinga lesingayo la. Abantwana bayareshwa, baqala kuba pregnant, babonwa isikole, babonwa i-Department of Health before bayofika kwenye indawo. So leli ziko lakho mhlonishwa lesemqoka kakhulu. But ke I must say express disappointment yokuthi abekho apha kuzo present akuthiwa basendleleni kodwa isikhathi besisibekile. I feel ukuthi this is not what we expected. Ukuthi singahlonishwa lesimemo ngalendlela okwenzeka ngakhona minister. I'm elaborating ukuze nxa uminister wethu oncwadi uMC wethu oncwadi la asukuma asibingelele asixelele kuba why iziko lakhe lingekho la. Siyabonga minister, sicela usibingelele baba. Thank you. MEC, I'm sorry ngijwayele ukukhuluma nabo minister. Mhlonishwa MEC sicela ubingelele indlu uzi introduce ukuthi ungubani. Thank you.
No, thank you, Chairperson. Good morning to you. No, Chairperson, there is a miscommunication. Let me be honest. We were told 11 o'clock. The communication was at 11 o'clock. That's why I'm early. I'm early, not late. Because the communication was at 11 o'clock. I do have my officials there. They are ready for presentation. Yes, so there is a problem of communication. I picked up when I arrived here that the 11 that we're told about is no longer there, and I didn't catch it up here. So I will apologize for that, Chair, but we are ready for the presentation. That's what I can say. Okay. No, Chairperson, thank you so much. We don't want to waste your time. We just want to appreciate, Chair, this particular engagement, especially in the province. If you look in terms of the trends, either sexual harassment or child bullying or teenage pregnancy or human trafficking. So I was impressed by the presenter when I come in about the deputy principal that has been arrested because we're battling whether to suspend her while still on jail because of the significance of that particular case that is happening there. But for me, Chair, I think this is an eye-opener, colleagues. I've observed that suspending and dismissing teachers is not enough. There is a need of the justice cluster departments to up the game. Because we can't go beyond the Criminal Act, Section 101. We can't go to the Child's Act, Section 154, as a basic education. So dismissing them, they will manifest and surface in another province. So you need a coordinated strategy of government machinery to deal with this particular pandemic, Chairperson. That's why we stopped everything today and say, let's be here, because you are creating a platform for us to deal fundamentally with this particular platform. Otherwise, thank you so much, Chair.
Sibonge mhlonishwa. Maybe it's us now that needs to apologize because the information that reached the table is that MEC is here, the department is not here. So your apology is accepted. I want also to apologize. In that case, then And believe me, MEC, I was looking there at the front, that young Mhlonishwa, ukuthi maybe it's him that can come late. I wasn't looking this side. Okay, Department of Basic Education, please, your presentation at a high level so as we can engage and see what we need to do. 15 minutes when intact, don't mind 5 minutes ethatho minister. MEC yo ngiyakuthanda ukuthi. We honorable members, please open your gadget for the presentation. It looks like they are not going to display there. Thank you.
Good morning to the members of the Parliament. Good morning to the meeting, and let me write on the protocol that has already been observed and perhaps apologize for the glitches. Honorable MEC, just pardon us, we are trying to flight the presentation. In the meantime, let me introduce myself. Igama lam nguLulamani Zenzile from the Department of Education in the Eastern Cape. Mine, Honorable Chair and Honorable Members, is just to present on behalf of the department in terms of the terms of reference that were shared with the department in preparation for this particular meeting. I don't know whether I should, Honorable MEC, proceed. Thank you so much. I noticed that the two individuals standing in front were born before technology. And as such, they are struggling a bit, but I think we'll find this particular AI challenge. If I may go through, honorable members and honorable chair, my introduction goes as follows. Please. Bese ndifuna ukuthi Honorable MEC xa ingakhalanga inkomo iyayekwa. Kodwa ke we shall continue. I was starting to present Honorable MEC and honorable members in the interest of time that child abuse actually in the province and in the country remains one of the most pervasive and damaging issues that are actually affecting our learners in the country. That is actually taking place within our schools, educators, and is often the first to observe in terms of abuse. And as well, we need to disclose the effects of that because children actually are facing a pandemic in terms of this particular challenge. And as such, the department, through educators as well as school-based support teams that are placed in the districts as well, are not only morally obliged, but also legally mandated to identify and report and address instances of this child abuse. Because failing to do so may lead to further harm to the child and legal consequences for the educator or for the school. Between the month of October and December 2023, all right.
Want to chit chat? Can we do it outside? Because some of us were getting disturbed. Thank you so much. You can continue, Hlonishwa.
Thank you, Honorable Chair. As I was saying, between the month of October and December 2023, about 285 children were murdered. And of that, also 2,707 survived attempted murder. They survived assault and other grievous bodily harm. This equates to an average of 33 children being violated each day, with at least 3 not surviving daily in terms of the incidence of violence. We're also saying offenses against children also presented a worrying trend. The reported rape cases involving children increased by 6.3%, which is a concern, between 2015 and 2016, as well as 2019 and 2020, in terms of the statistics of South Africa 2023. Despite these alarming figures, child abuse remains vastly underreported, and we are calling upon the community and everyone to report such incidents. As a result, the actual prevalence of this abuse and violence is likely far higher than what actually is reflected in terms of the data that I'm presenting. Honorable Chair and honorable members, let me not then, thank you so much. We have finally found the technology that actually we were born before. Thank you so much, sir. I was still in my initial slides. This is the slide that talks about the legal framework, which I won't bore the meeting in terms of going through them. Safe to say, I believe we are all, aware of them. I will just, Honorable MEC and Honorable Chair, to try and summarize this presentation in terms of time and say, we are saying as the department, the tendency of educators to sexual abuse learners is in various ways is very much unethical. It's very much unprofessional, and this is a criminal offense that should be condemned. This is a serious misconduct in violation of constitutional rights because learners are sent to school to attend school but not to be violated. Section 54, subsection 1, paragraph A of the criminal law in terms of sexual offenses and related matters, as amended in terms of number 32 of 2007, puts an obligation to all persons who have knowledge that a sexual offense has been actually committed against a child and that person must report such knowledge immediately to the nearest police station. As well as paragraph B makes it an offense not to report that's a sexual offense against that child, which then means the person who knows of what happened and chose not to report is actually found to have committed a criminal offense. So we're encouraging that the reporting of sexual offenses and any other related offenses must actually take place, because as I indicated in my presentation, is that there is an underreporting in terms of the statistics that we have observed. Section 110, subsection 1 of the Children's Act of 2005 puts an obligation actually on all educators and other listed professionals like nurses, social workers, medical practitioners, and so forth, to report to the Department of Social Development or designated child protection organization any reasonable suspicion that a child has been physically abused or sexually abused, deliberately or neglected. We are then saying Section 17 of the Employment of Educators Act imposes a mandatory dismissal sanction. I think the Honorable MEC spoke on this when I was coming in, on educators that actually found guilty of this particular assault on learners and sexual related with relationship within the learner. I think the MEC has spoken about this lengthily, and he's actually condemning this particular aspect. The Code of Conduct says, that is Code of Professional Ethics, prohibits any form of sexual abuse or sexual relationship between a learner from any school and a learner with an educator. Allow me, Honorable Chair, honorable members, not to bore you with some of these slides, but perhaps go straight where the crux of the matter in terms of presenting the statistics of what we are talking about today. But to say, without delaying the meeting, that the department is doing its utmost best, even establishing a call center to report these incidents and take drastic measures against anyone who has committed these sexual offenses against the learners. We are really condemning as a department these sexual offenses, and we are not working alone. We are working with the Department of Social Development, we are working with the SAPS, we are working with civil organization and all the stakeholders that are relevant in this aspect, to ensure that everyone that needs to be on board is on board to condemn this particular animal, because this is becoming an increasing aspect or conduct that our society actually has found itself, having a challenge on. Then you ask yourself a question: if our educators are actually perpetrators in this regard, where is Ubuntu? We are a society that actually lives without that particular aspect. There are protocols, Honorable Chair and honorable members, that actually are followed, that are giving guidance in terms of how to report these incidents, who to report, and when, and what needs to happen when you report these incidents. Remember, I did indicate in my earlier slides that should I then become aware of this incident and I don't report, I've also committed an offense and I can be charged criminally for negligence, failure to act, in other words. This is, I think, one of the elements that I think I need to present to this gathering. Honorable Chair, I'm presenting to you what I call sexual misconduct cases that have been reported and recorded by the Department of Education. I'll just skip 2021, 2022, 22, 23. I'll just go to 25, 26. Honorable Chair, if you allow me to do so in the interest of time. For 25-26 financial year, we have recorded and received 29 cases, and we have managed, in terms of engaging and deciding and finalizing those cases, to finalize one case, and we have outstanding cases that are sitting at 16. Employees that have resigned and retired as a result of this is 1. There is no case that has been withdrawn, and there's no sanction actually that has been actually discharged. This is, but across the districts in terms of the statistics, which I won't bore the meeting by going through them, and I think the presentation, if it's not shared, it will be shared with the members of the parliament. This is, I think, one of the slides that I need to talk to Honorable Chair and Honorable members to say precautionary suspensions in force by the department as a result of these particular offences. If you look at sexual misconduct, you're sitting at 21. You look at corporal punishment, you're sitting at 2, financial misconduct, but the crux of the matter is on column that talks to sexual misconduct, which is concerning, sitting at 21 across the districts that the department actually works with or on. This is the stats, again, that is I need to present in terms of sexual misconduct from the previous year. I want to compare the previous year together with this current financial year. If you look at learners alleged to have, I hope that the slides are visible. If you look at the column that talks about learners alleged to have been raped, you're looking at a total of about 8. Other form of sexual abuse, you're sitting at 11. Number of learners under the age up to 18 that are alleged to have been raped by educators, sitting at 9. Again, learners that are underage that are subjected to other form of abuse by educators, you're sitting at 6. 1 is too many. Then we're saying how many educators facing criminal or arrested for sexual offenses on learners. The department is acting on this, working with SAPS. We're talking about 9. Again, 1 is too many. How many educators that are sitting behind bars that are in prison as a result of these incidents? There are 6. How many they are out on bail? Only 1. How many learners under the age raped by non-educators? Remember, we also have non-educators that we're working with as a department. You're sitting at 4. And then we're saying how many non-educator employees arrested for such misconduct is 1. These stats, I know, is disturbing and it's concerning. In terms of the current year, Honorable Chair, honorable members, number of learners alleged to have been raped, you're sitting at about 6. 1 is too many. Other forms of abuse, concerning number 25. Again, number of learners alleged to have been raped by educators this current year, you're sitting at about 6. Number of learners that are subjected to other form of abuse by our educators is 2 across all districts. Number of educators that are facing criminal charges or that have been arrested as a result of these incidents, you're sitting at 8. How many of them that are still in prison? 1. And how many of them that are out on bail? We're talking about 3. Let me see, and I'm not going to argue about the rights and constitutional rights and everything that one is subject to be proven until, I don't want to get into that, but I want us to be concerned about what we do and what justice is doing in terms of what needs to happen when the child is alleged to have been raped. Yes, we know that one has a right to be proven innocent until otherwise. I mean, has a right to be viewed innocent until proven otherwise. How many learners that are under the age of 18 raped by educators? We're saying there are 4. And how many educators, non-educator employees, actually that have been arrested, we don't have for this current year. But these statistics, Honorable MEC and members of Parliament and everyone in the House, is very much concerning. It's very much concerning. And we call upon our stakeholders, our social partners, our SAPS, our justice system to come on board and ensure that what needs to be done is done. These are just but the names where these offences and incidents have taken place. Honorable MEC and honorable members and honorable chair, we have not put names due to legislative mandate that I think we all know. But safe to say, we have managed to put a statistics that is going to indicate where did this happen, in which school did this happen, and what is happening. It allow me not to go case by case, but to indicate, to say, across all districts where these incidents have happened, this is what we have done, and this is what we are reporting as the department. Again, it's continuing. It started with 2024, 2025, and this is 25, 26, where I spoke on terms of the numbers of these incidents. This is what I call, Honorable Chair and Honorable Members, a challenge that the department is faced with, because the department does not have all the resources to be always on the ground, but it's doing what it can do, its utmost best to ensure that all these cases are attended to. We have guidelines we have developed as a department that are actually indicating what needs to happen, who to report, when to report, where and how to report, as well as issuing directives as a department on what needs to happen to curb this pandemic from where it is going further. I did indicate, Honorable Chair and Honorable Members, that the department actually, through its advocacy programs, has established a call center and has set aside and put aside, working with the Department of Social Development. There are social workers, there are psychologists that are in place to sort of attend to the learners that have been affected, to restore their dignity, to restore their humanity, because I can imagine what a learner goes through, or a child, when he has been exposed to such traumatic experience. That child will never go back to its humanity, but we must do what we need to do as a collective to ensure that we restore that child back to it, the manner in which that child was. Yes, the most unfortunate thing, Honorable MEC and honorable members, is that life itself is permanent. And that which has happened can never be changed, but we can do something in ensuring that the child is able to continue to live despite what the child has actually experienced. The department is working, as I indicated, with the Department of Social Development, with the Department of SAPS, our NPOs, the Justice Department, to ensure that we do what we need to do at the time at which we need to do, and curb this from happening any further, so that we restore dignity and humanity to our learners. We condemn the educators and non-educators that are actually doing this, and the department has taken drastic measures in ensuring that these cases are investigated, and where educators are found to have are found guilty, there are actions that are being taken, such as putting them on precautionary suspension. And I think the Honorable MEC, as I was coming in, was talking to the fact that when one is in prison, I think as a department, we must look in terms of saying, if this person is facing this challenge and is in prison, what is stopping us as a department from taking further actions in terms of that? I think, having said that, Honorable Chair and Honorable Members, we will do our best, Honorable MEC, led by your good self, to ensure that this animal is put to rest. I thank you.
Thank you so much. And le generosity ukuthi ngikuedela u6 minutes so long emphasize ukuthi ngiyaxolisa ukuthi ngiqale ngakuhasha before present. It was just an emphasis of our apology. I gave you 6 minutes extra, but I'm glad that you managed to present everything that you wanted to present. Honorable members and everyone that is in the house, this was the last presentation for now. I think MEC Waga Health or Department Waga Health, I know that there was a CEO when all the big guns Zaga Health, they will fight us if we don't take a comfort break. We will take a comfort break before we engage with this discussion. But before we take a comfort break, I want to give Honorable Chair of the Portfolio Committee to say something. Thank you.
No, thank you very much, co-chairpersons. Just to thank the two MECs again that is with us, the CGE Commissioner. Thank you very much to everyone for your presentations. We are very sorry that we only gave you limited time, but I'm glad they did so well in managing the time. But what we'll do when we come back, colleagues, you'll just do a 5-minute break, and then we come back and we're going to allow each person to ask questions of clarity to your departments or to make comments. But remember, we are not here to interrogate the NGOs. They are the ones who are the foot soldiers. They are the ones who are doing the vital work on behalf of the states, on behalf of our children. So ours is just to give our NGOs support, but to ask any questions of clarity from the departments that will then enable you to give us the recommendations that we need to give to the National Assembly when we go back to Parliament. But we'll give you, what is the time now? It is 11:22. We'll start with the question and answer session at exactly 11:30. So we've got 8 minutes. Thank you.
So, yeah, I think I had that question. And then also to the different departments, it didn't come out very clearly from your presentations. You said that you work with your fellow departments, but it didn't come through how. And what was concerning to me was kind of the disparate reporting between the different departments. If you look at the statistics, one department reported on in this particular way, the other department, reported in another particular way. I've also noticed that one of the shortcomings of the Tutuzela care centers has been that the services are so fragmented. I would always come to a department or Tutuzela care center and say to them that your blueprint, your framework should be there on the counter. Because when you get to the different TCCs, you find that one person is accountable to DST, one person is accountable to DOH, another person is accountable to, the NPA and different structures. But I never got a sense of how do these entities work together. And they were also very, very disparate in terms of service provision and the availability of services. And this is where my thanks go to the NGOs, because the NGOs who work in the TCCs, those are the those are the TCCs that you could see were really strengthened. We had NGOs who said to us, like our counselors who are here, sometimes have to back up the nursing staff because there were not enough nurses. And sometimes when I got to the TCCs, we were told that if a rape happened over the weekend, somebody would have to come back on Monday to get counseling, which for me makes absolutely no sense, because the genesis of this model of the TCC has been in response to people going to sit in an emergency department where they are waiting on long queues or having to come back for certain services at a different time. So I didn't get what was the integration of data across the different departments that could be strengthened. And I also didn't get a sense from the different departments about how you mentioned NGOs, but you didn't really state the contribution of these NGOs within the different departments that you work, colleagues. I'll stop there. Thank you very much, Chair.
Thank you. I guess we will now go to the honorable members, and we will start with the chief whip, and the mic can then be handed down. You got a hand up? You are recognized, honorable member.
Maybe let's indicate members that we know that everyone will want to say something. So we will start from this corner right around towards the end. If you are covered, just pass the mic as a plea, because you only have 2 minutes to comment and ask questions. Thank you.
Thank you very much, and I would like to just appreciate the presentations that have been made. From my observation, Ngaki up, and this would be the lack of coordination amongst departments, but also providing the necessary support. So the questions then I'm going to sort of ask would be centered around the work that is done by social development and Department of Health, and also with education. What type of interventions have been put together as part of your intervention strategy to combat gender-based violence, but also statutory rape? Because I think there needs to be a collaborative approach. My next one would be then appreciating the work that is also done by the NGOs, because they are the ones that are the foot soldiers and are really getting the root of the problem. Social development can respond to this. What type of mechanisms and support are in place to actually empower and equip, but also to capacitate with resources these NGOs that have presented? Because I think the stats that they have presenting are quite shocking, but also there is a cry to say that there are not enough resources, and therefore even human capital for them is a problem. And also the salaries in terms of what they're able to pay staff members to do the work is a problem. My last one would be the issue of social workers. This was even mentioned in Gauteng. We've got lots of social workers, thousands of social workers who are sitting at home who are qualified. What is social development's plan in ensuring that those social workers are poured into the system and are able to provide these basic services? Because we cannot have social workers that are graduating but are sitting at home, and you've got NGOs who are saying they are struggling with human capital. There needs to be an integrated plan that seeks to say these social workers must be placed across the entire province, and also in the areas that we see that are greatly affected by statutory rape and abuse. My last one would be, it is the responsibility of each and every single citizen to report any form of abuse against a child, whether you are an educator, whether you are a citizen, a community leader, etc., an official. What accountability measures are in place? And my last one to MPA, I think it is quite disheartening to find that the MPA is at a point where it's able to give perpetrators, bail. I think MPA needs to really respond to what is MPA doing to really combat gender-based violence, and also to ensure that perpetrators of statutory rape and neglect and abuse against our children, they are held accountable. And I think NPA, you need to really give us an overview of what you're going to do going forward and how you're going to support the work that is being done by those who are on the ground to ensure that perpetrators are not released and are not put back into the communities. And the last one would be the psychosocial service support that's given to victims after, and the awareness raising campaigns. But overall, thank you very much to the organizations, and may you continue and keep up the great work. We do hope that you are capacitated with the necessary resources that you need. Thank you very much.
Thank you, Chairperson. Now, I think I was covered by the Commissioner and Honorable Adonis with regards to how the different entities or departments work together, and also the matter of the NPA. Thank you.
Thank you very much, Honorable Chairperson. I also welcome the presentations that we have received today. I also would like to express my condolence to the family of the young woman that the MEC mentioned earlier on, that has killed herself because she was allegedly raped. The perpetrator was arrested and released on bail and had to go back to the Nelson Mandela University. And for her to meet the perpetrator on the school premises, we expressed our condolences to her family. With that being said, I think I want to zoom in on the presentation by the hospital or the health department, actually. The presenter indicated that some cases need to be reported by the nurses, but the nurses, they don't report them because they're not experts and they don't want to spend hours in court. But the Children's Act 38 of 2005, Section 110, subsection 1, states clearly that nurses are parts of the profession that are supposed to open cases. It does not say they need to be an expert in opening cases. This is an indication that the health profession is dropping the ball. You are dropping the ball, guys. You are dropping the ball. You must open these cases, allow SAPS to investigate. And I also want to find out how many cases of young persons with disabilities have you received in this province? I did not see any mention of that. And also, the sign language was enacted by the president in 2023 as an official language, the 12th official language in our country. I want to find out how far have you gone in terms of ensuring that in all your offices, this goes to social development as well, and Department of Education, that you have persons that are able to communicate in sign language, that are going to be able to receive communities or that constituency that uses that language. Coming to social development, when the presenter was presenting, there was on the slide where they mentioned that what impedes mandatory reporting is lack of knowledge or clarity. Many professionals are unsure of what constitutes reportable abuse. I do not understand that statement because we are talking about statutory rape here. So when you say your professionals or your staff needs clarity on what constitutes a reportable abuse, what do you mean by that? Can you please just give me examples of cases that are not reportable or that are of statutory rape? And okay, I'm wrapping up, Chair. Okay, I also wanted to commend the work that is being done by Makiwane Women's Rights International, the NGO. We appreciate your work and other NGOs as well. In the interest of time, let me wrap up. Chairperson, I just want to zoom quickly to Department of Education. The department indicated that the perpetrator will normally be arrested, and upon being found guilty, it is only then that they are put under precautionary suspension. I just want to seek clarity. Honorable members, please slow down a little bit. I just want to get clarity on whether does this mean while the case is still in court, the learner now is supposed to be in the same school with the same perpetrator. I need clarity on that. And the last one, it is the issue of reporting. You've indicated that the number of under 18 persons that have been violated. I think I would like to find out how many children that are between the ages of 17 and 13. That will give us an indication of how many kids in the primary school that were violated, and the number of 14 to 18-year-olds. That will give us an indication of how many children in high school were violated. Thank you very much.
Yabulela, Chair. Mine is just to comment on the good work that is being done by the departments. But my concern is regarding Masimanyane's concern, where they were also concerned about the illegal pregnancies that are posted. There are people that post on the ordinary polls on the streets. What is happening to those numbers? Because those people, whenever they post these illegal abortions, they always post their telephone numbers. So I want to know what happens. Do they arrest these people or what is happening? And my last point is the shortage of safety homes. I'm very concerned about that. It's a worrying factor. And Minister, the MEC, I'm sorry, MEC, you'll find that I'm a rural person. I'm from a rural person area. But in most cases, we find that these people that are being raped are the people, it's due most of the time to the overcrowding of their homes. You find that they sleep in a roundavel or in a small flat, we call it a flat, with 2 or 3 beds. Some they sleep on the floor. So you find that the same mattress they share 2 or 3 people, they share that kind of a area, that is the bed or the mattress. I'm very worried because I've got cases, I know of places, I know of children that lost their parents. They are staying alone. And the parents passed away, leaving another, small children. And you find that it is the girl child now that is looking after these children. And the place where they stay needs much to be desired. I'm just worried about this. I just wish these safety homes, we can maybe check also into the way that they are staying in their own homes. Thank you.
Thanks, two chairpersons. Let me join my colleagues by welcoming all the recommendations. I've got only few input under the presentation of health it says that the 16-year girl pregnant is a high risk, according to the presentation. So they refer them to the social workers. But on the recommendation of the social development, they say that they have shortage of social workers. I think we must fix this. All the departments, not one department. All of us, we know the reason is the budget. I think it needs a collective recommendation to Parliament so that we can move, because we cannot move. We cannot move without the social workers. So I'm not saying that other departments are not important, but the social workers, we cannot move without them. So let's fix this, Chairperson. I'm partially covered by you, my whip, the chief whip. I cannot repeat what you are saying. But the other thing is that they say 10 to 14 years teenage pregnancy, they are dying. So I want to check under the presentation of health. They are saying they don't. They have the Funda Friday. It's the Funda Friday. Yeah, so I want to check if under the Funda Friday we have got enough staff to make the awareness, because I think this is a very important program. If we go all around, make the people that they be aware of this. So I want to check if we have got the enough staff. If we don't have enough staff, what is the reason? Because there is no reason or recommendation under this one. That's only my input, Chair. Thanks.
Thanks, Chair. I think I only have 2 or 3 inputs in these all presentations, but one, I think as this room, we need to look at what causes young kids or young girls to be able to be fertile at such young ages. Maybe that can also be a contributing factor to the statistics. Because you think to yourself, at 10 years, I was never thinking about anything that will fertilize or produce a child. So there's really a need for us to do a lot of investigation towards the fertilization of young girls. And also, I just wanted to find out, okay, another thing that we need to put in the room is cultures, values, and characters of families, because there is no way a child of 12 years will be pregnant and it is treated as a normal act in our cultures. It's something that needs to be addressed in all platforms, that needs to address it. And even if it means that we counter with parents and family members, because it's something that is going to disturb our children. I was looking at the number that the province has presented, it's 1,118 cases. And I'm saying to myself, these 1,118 cases in the future will be those disturbed parents, regardless of what happens now. It literally says already we have 1.1 people that are going to be disturbed in the society, without us even taking into consideration and thinking about it. But we know Mamufantu, but they will be disturbed because they will always be triggered of what happened when they were 12 years and 14 years. But regardless of that, I think what we really need as a strategy to respond to these challenges is having strategies that are coordinated, that speaks to one another, NGOs that speaks to social development, basic education, health, all these systems, and the justice system must be the forefront, so that when we charge these teachers, they have a criminal record, so that they are not accepted elsewhere to continue with their journey of abusing and violating our kids. But another thing that we also need to find ways and means of talking about, as I'm about to finish, we need to draw close to the question of talking to our kids about sex, as young as they are. And girls, we need to be very frank and fluent to them in saying there is sex, there is condomizing, there is abstaining, and there is a normal procedure of termination of pregnancy. We must not make it as if it is a sin
We must not, as parents and the departments, we must not provoke it to be something that is wrong to do, because that's why they go to illegal spaces to do it. And when they go to illegal spaces, it will go and be encountered in the maternity, in our institutions, because when they overbleed, when they run out of blood, when they are complicating, they are sent to our institutions and they complicate, and their death will be calculated within us, and yet the procedure was done illegal. So it's these talks that will allow us to be able to say to kids, okay, you are pregnant and you just, whatever you did, but you don't want the baby. It is okay for us to talk about termination in our spaces, because if we don't, they will continue getting the illegal termination, which costs us their lives and their and
on adolescent reproductive health and sexual education. Under social development, despite that, the department's constitutionally and statutory mandate to ensure the care and protection of children. The presentation reveals that 1,118 cases of sexual abuse and rape were reported in the Eastern Cape in 2024 to 2025, with Nelson Mandela Metro or OR Tambo and Alfred Nzo, recording the highest cases. Give these alarming figures. How does the department account for its failure to enforce mandatory reporting previous, ensure adequate supervision of social workers, and address the systemic breakdown in accountability mechanism that allow under reporting and delay respond to persistent. The presentation content that social service professionally are overbounded, that there is a shortage of shelters and vehicles, and that indicated human resource and digital tools continue to impede a case management. If the department has repeatedly committed to prevention and early intervention under the National Strategic Plan on GBV and femicide, what's explaining the persistent underfunding, lack of interdepartmental condition, and weekly referral pathway? And how does this failure reflect on the department's governance capacity to deliver its children's protection mandates effectively?
My apology, Honorable Member, I'll have to, taking too long.
Oh.
I really want to apologize. Just before I go to the next Honorable Member, we were joined a bit late, but early enough to capture all the presentation. Honorable Chilwa, we recognize you. Thank you for coming, because you came after the introduction. And just now, I don't want to be disciplined. Mang figure Parliament, whip one, ugqiba kufika ngoku bekabhizi eGauteng ukwiphe portfolio yaka health. Umamxhego, you are welcome, Honorable. We've seen you. Thank you. Can we pass the mic to Honorable Mkhize, and please just mind the
Thank
time.
you very much. I will cover some of the points Honorable Mgati was covering. Thank you very much to all the presenters. We highly appreciate your hard work. Now we know that there's ever increasing sexual violations. There's poor reporting of cases, shortage of social workers, needed a multi-sectoral approach to address the issues of learner abuse, understanding the interconnectedness of social issues, lack of coordination by communities, lack of evidence to charge and prosecute, huge backlog to investigate and administer justice, shrinking fiscus, victim dependency on the abusers, and that there is NGO cut, which the state chair is still failing to close the gap of. As a result, organizations like Makiwane are struggling to provide the services that we are applauding them today for providing. So clearly, we know what's the problem. And when I listen, it sounds like we know what to do. But the question is, why we are not doing what we're supposed to do to change the situation? I'm calling it for further reflection, Chair, because I think we must allow our reflection to progress. We know now what's the problem, how it comes about, but now, where's the plan to address it for all departments to reflect on it? Last point, who is responsible for coordinating all the departments and partners? Because we have agreed that multi-sectoral approach is required to address the problem. So who rests with the responsibility to coordinate all the partners and stakeholders to make sure that we have a multi-sectoral response to the challenge? If that person could perhaps account, because that's where it seems we are collapsing, so that we can move forward with the discussion. Thank you very much, Chair.
Thank you. You can pass the mic with this side to Honorable Chirwampungos. Please forgive me, I always forget the second surname.
Mpungose.
Double barrel surname.
Yes. Greetings, Slalo Ngbonge, for the opportunity to speak, and members, staff members, and all the leaders that are present. Slalo, we have a problem here. I don't know how to say it with respect, because what we're being exposed to as a committee is utter disrespect. And even worse, to our children who are pregnant as we speak in classrooms right now. And we've got leaders, provincial leaders, who are blaming teachers, who are blaming nurses. They've got all the power within their offices and the support staff to ensure that if they wanted to do something about it, they would have done it. Because as Babu Zemaji, why have you not put the schools with those young girls as young as 9 and 10? Why have you not put them under one roof and ask them, who are these kids? Where do they come from? And take those kids yourselves as the provinces and report them to SAPS. Why have you not done it as the leaders yourselves? Because you can see Utigunama gaps. And all these gaps you mentioned, the members are correct to say, you know the gaps, you know the loopholes, you even know the solutions, but you're not enacting them. Because the truth is that I need this gagala. You just don't care. You just don't care. Those kids are there already. They're in the clinics and the hospitals right now in this very moment. They're in the classrooms right now. DSD is busy closing down AMA safety homes and refugees and then coming here to act a victim. But you're outsourcing all the functions you're supposed to have as a department. You're outsourcing them to the NGOs because you just want to tick off boxes. And then you give over this tendency to the NGOs and just ask for numbers. No tangible results that you take with you as a department. We're going to put all these things in the recommendations, because when we tabled this motion as the EFF to say we must have this public engagement, we wanted to expose the kind and caliber of leadership that we have in this country. It's not a mistake that Eastern Cape is there on the top. That's why children are dying the most in this province, because they are hungry. You're not taking care of them. They are raped, you're not responding to them. They're carrying pregnancies, you don't report them. You want to blaming nurses. The laws are there. Create the guidelines. Why have you not done that to date? Why have you not created systems to make sure that each and every case, there is no case that falls through the cracks? If you look at these cases from perspective of 15 years, you're wondering there's even much more. We're sitting on hundreds and thousands of girl children in this country who are rape victims, who live with their children, who come from rapes, who live with their rapists in their house, who are raped by their teachers in their schools, who are raped by their classmates in their classes. And then Nina, as the leadership in the provinces, are telling us that the problem is nurses. The problem is nurses, the same nurses you underpay and overwork. Please. Ngiyabonga Sihlalo. Ngiyabonga kakhulu ukuthola leli thuba. Thank you so much for ama presentations. Although I'm not happy, okuningi sebekukhavile kakhulu, but I'm worried about the departments nami ngihamba emazwini kaMpungose ukuthi you guys are busy nisinikeza ama stats ama numbers amakhulu athini like nje khona basinikeza 1181 but ayikho into eshoyo ukuthi na imapha ama cases aselungisiwe abantu ababoshiwe bangaki obani abanjani but niletha inumber le ethi la ku report into engaka then nenzeni ngale number enkulu kangaka ezenzekile. And you know guys, you have a nerve yokuthi nizositshela ngendaba ama social workers ukuthi awekho kanjani ngoba nina you do have ama budgets and everything. Why don't you budget for these people ngoba iyona into ebaluleke kakhulu le, then lama conference abhedayo inhlenzeni wenza ngoba ayikho lento landa ama indlanta ama labantu abalethwa ukudla benzani ekubeni ingane zethu zibe zifa lapha ngaphandle. Kusizana ukuthi nenze lama conferences amakhulu angenamsebenzi kunokuba nithatha imali ibudget nifake ekuthena niqasheni ama social worker. Baningi abantu bafundile bama social workers but abaqashwa umuntu nizoba nesibindi sokuzoma phambi kwethu nisitshela ukuthi inkinga ama social workers. Why kunenkinga ama social workers? Imali ibe ikhona. It's because nithatha imali nifake intweni engasho lutho nokusuthisa izisu zenu. Thank you.
Before Honorable Mkhize Xaba speaks, we honorable members, we can put our comments and questions across in a respected manner. The last say to send Tati Malini Fage Swinzen, I don't think it is proper. No, honorable members. Please don't challenge me. Honorable Mkhize, can you Honorable Xaba, please you can come. Thank you.
Thank you. Thank you very much, Shepesi. Shepesi, I'm sick, man. Don't make me to laugh. Kuba, don't be cross like this, Mtanam. Let me welcome all the presentation. Honorable Chair, it seems like all these presentations is a cycle. They are saying one thing, nothing different. All of them, they are saying one thing when they are saying it. But because everything has been said by my honorable members, I won't be long. I just have one question, or maybe it's a question seeking clarity, or is a comment, I don't know. It will be seen by my chairperson what is category. So, Chair, I was touched, man, Chair, about the presenter. I forgot because there are many presenters, and also I'm also going up and down. When she said, I don't know why is a she or is a he, said there was a case that was opened, but the police refused to register that case, to open the docket. I don't know whether I was hearing clearly. I'm standing to be corrected, honorable members, if I'm wrong. But I hear that issue of the police says there is no case here. I cannot open this case. If it was, honorable members, yes. That is why I want just that question to say,
A problem we are facing in this country is that police, they don't know their work. They don't know where they stand for. They don't know their stand. They don't, actually, it seems like they don't have their stand. Because if you are a police, your job is to arrest and send it in custody. And the magistrate and the judge, they will determine whether this person has a case or not. It's not a job of the police to say we cannot open this case. That is why we have many commissioners in these days. That is why we have many commissioners and ad hoc, whatever, everything in the country, because of these police who don't know their work. They don't even want it to. Oh, okay, Chair. No, it's fine, Chairperson. I was just want to ask that, where is that police station? Which police station is that one? Maybe we can send a message to that police to take him or her out in that police station, because he don't know or she don't know his work when he's there. He took the magistrate work and the judge's work. He judge, he police, he do everything alone. So I want to ask, where is that police station? What is the name of that police? Who's gonna help us about that information? I thank you, Chair.
Thank you, Honorable. Before we go to the responses, we just want to add something, me and the Honorable Letlape. In the Department of Health, they said Funda Friday. From my understanding, that Funda Friday is conducted by the district, whoever, to the nurses that are dealing with this. And that Funda Friday, when it was mentioned, you were talking about the F22. Because what it's happening these days, le generation corner, they're lazy to complete the forms. It's not that they don't know, but the time consuming and stuff like that. Having said that, we understand what if now you are faced with this 14-year-old in front of you at the PET, it's an emergency. You deal with that, you refer whether whatever the procedure, but what happened to the follow-up? Because even if usebenza in the emergency department, you get a person who assaulted, kube emergency if you need to rush to theater, but still batubandela form lama policy J88. The doctors, they will follow up to complete that form. What happened? These pre-teenagers and teenage pregnancy, we don't do this follow up. Once aphume ezandleni zakho sowuphumile, isele leya form lokufuna igcwalise to open the case. I know ukuthi if we are a healthcare worker, I've been there. Once kushona umuntu kuthiwa it's an unnatural death, iphoyisa malifika wena nurse uvula case lo hander over board. I can't say no, I can't open a case. Imina le ngibanikeza le board. What makes it difficult? Because if, like all the honorable members, they are talking on this, because all the departments, mandatory reporting is a problem. What makes it difficult? Because it's by law that everyone that comes across these pre-teens and teenage statutory rape or pregnancy, you're supposed to report. Bonke labantwana ba deliver clinic naseyibhedlela. There's no way ukuthi umntwana waka 10 years angadeliver ekhaya. Why are they not reported? So the mandatory reporting is a problem. Of course, what all the honorable members said, I will also say something on that, to say all the departments, they work in isolation. Anihlangani, akuna coordinated effort. And this thing ukuthi amaphoyisa awekho cooperative, it's what you hear everywhere, of which that's something that needs a round table ukuthi silungise, because okunye yes, kunida thina as parliament to do something, but okuningi la on the ground we can fix it. We can't let our children babe so abused and then we're still talking kuma programs are uncoordinated. I don't want to say much, I was widely covered by all the comments from the honorable members. Honorable Letla.
Thank you, Chair. Or Co-Chair, just wanted to firstly apologize to yourselves because you are not usually exposed to the enthusiasm of members of parliament. Uh, uh, and just to say that we need to be given information of how to make mandatory reporting work, not why it doesn't work, because we can't help you not make it work. So it would be helpful to have recommendations from you as to what are the problems, what are the solutions to that. And frankly, what's the benefit of mandatory reporting if there's no mandatory investigation? There seems to be a gap in terms of interagency cooperation, where when the police get a Form 22, there should be a process that they are trained on that is agreed upon in terms of how it gets processed and how it moves forward. It cannot be the person who's reporting now being told, I need X, Y, and Z. That person has done their job. And if it's going to work, but there's no program of action about how it gets to the conclusion of a person being apprehended, then it's not worth the piece of paper it's written on. Now, just a quick question. I know the chair said we shouldn't ask the NGOs questions, but I just have one that relates to the issue of human resources. You spoke about some posts that are partially funded by the state that you raise money for to augment that salary. And there's a challenge about donor funding and people withdrawing funding. I just want to ask, what is the equivalence of the salary we pay in the NGO compared to the salary in the state? Would absorption be automatic, or would there be challenges of salary scales that don't match? And how do we deal with that? Because I found that in HIV and AIDS, that was a major problem, where the people in the NGOs were far better paid than the state people, so they could not be absorbed. So we need to talk about sustainability of these programs unless everything is just going to collapse. Lastly, there has to be agreement about reporting. We can't have figures that talk about 10 to 19-year-olds when 18, 19-year-olds are adults in this conversation. So we need segregated reporting where you're either talking about 0 to 14 or 0 to 16. And you can then have subsets of particular areas of concern. Because it can be that victims like Baby Tsepang, victims like the girl child that died 4 months ago in El Dorado Park, seem not to be part of the conversation. So it has to be from zero because of the appalling behavior of South African men. So it's not just confined to 8, 9, 10-year-olds. So we've got to have stats from 0 to 16 with respect to this matter. And there has to be an agreement on how we report so that the figures should flow and there should be cooperation. You can't have different people using different matrix because then we are not going to be able to know what the extent of the problem is in the country. Thank you, Chair.
Just one thing that I wanted to comment. We are here for statutory rape of the girls. But there are departments that in their states, they've started looking into the male child. We want to commend that, even though, because this thing of becoming reactionary, because we leave the boy child until it's too late. So we want, though I'm emphasizing that ours was about the girl child, but I want to commend the departments. There are so many that presented the stats around male statutory rape. So we want to appreciate that.
Yeah, thank you very much. I won't be long, but just to say the reason why we're focusing on girls only at this stage is because the motion that was passed in Parliament said statutory rape of girls. But as I had indicated from the beginning, this is our first investigation, and hopefully when we put recommendations to Parliament, we can expand the scope of the work that we are doing in the new year. But I wanted to ask a question, maybe just a simple question. In my mind, it seems like, apart from the fact that there's no coordination between various government departments, it seems maybe there should be an online tracking tool where all of you can log in and you can report cases. And if we're talking about the thousands of social workers that are sitting at home that have not been absorbed, maybe if we go back to Parliament, because in 2018, MEC, Cabinet took a resolution that said all of these social workers must be absorbed and deployed to various departments. And we cannot win this fight without foot soldiers on the ground. So maybe if there was an online tracking tool where you could log in as basic education, health, social development, and you log your cases there in terms of mandatory reporting, you start there by that platform. That platform then enables all of you to monitor the cases, and it also maybe automatically then dispatches social workers to a case. Would that be something that we could recommend to Parliament? And is it something that you think could enable you to better do the work that you need to do? And then maybe Mama MEC, I want to know, we expect so much from NGOs and they earn so little, and the money that they get from government is so little. I want to know, in this province, have you closed down any children's homes? Have any NGOs closed their doors because of a lack of funding? And what generally is the relationship? Because, I often find this to be a very interesting scenario. Government expects NGOs to provide vital services on their behalf, but when it comes to their monies, they must beg. They must beg. Often they must go out and find partners. Partners dry up, and often then, they are just not able to do what they are supposed to be doing. So, what is the situation and the relationship between your department and NGOs in this province? Thank you.
Thank you very much, Chairperson. And thank you very much to the members of Parliament for the comments and constructive criticism. One thing I enjoy is constructive criticism. I'm becoming worried when it's becoming personal. I'm becoming worried at our levels. We're ready for being criticized and whipped, but it must not go down to be personal. We've got full soldiers that are ready to work. As women, we really need to support one another. I will give to our officials to respond, and as MECs will respond. We really would love to respond. Excitement, we're used to it. It's not new to us, but in a very constructive ways. Thank you.
Thank you. Okay, we'll give the mic and then you'll divide.
There's the mic. You can just use it.
Okay. Thank you very much, Honorable Chair and Honorable Members. As I indicated, I've got my Honorable MEC next to me, who is also very passionate about this program. And I do have my colleagues who are also here, and I will quickly assign some of the question responses to them. But I want to start with the one of Untitled. Untitled is a cultural group that is led by women in Eastern Cape. And in most cases, but let me not say it most, it's driven from the traditional leadership. It's a very respected group that seeks to ensure that the behavior of women is addressed. Basically, what they are looking at is it's moral regeneration, where young children are taught on how to, about sexuality, how to behave, how to say no. However, it has been observed that because the main, one of the things that is critical about it is to ensure that you restore virginity. But we observe that in some instances, children being children, they will start doing other things. And we came on board and working very closely with health, because when there are those sessions, us as health is to provide information to children to say, we as health, in cases where there are
challenges, you get yourself involved in a sexual activity. We've got prevention combination, we've got condoms, we've got this, and in instances where you fall pregnant, that's what we do, because we've got to be realistic. If you fall pregnant, a lot of our facilities, even community health centers, they offer termination of pregnancy services. Now, so that is the kind of partnership we have. So we provide them with all the material that would, in terms of us partnering and educating women, and we observing a very good, I would say, change, because it's a pity I could not be able to show the statistics in terms of the pregnancies among the ages 10 to 14 for OR Tambo and Alfrenzo, suggesting that these interventions are working, because remember, a 10-year-old is still a child at home. So the community, the parents at home, they really have to take a responsibility. So that is the Inrio one. And in terms of the statistics as health has got the source. Let me talk about the source. Where do we get the source for reporting as health? We're using the district health information system. Now, so that if I say I've got 10 children that have delivered among the ages of 10 to 14 at this particular period, whoever goes, when you run that report, you actually get that number. So as health, and depending, secondly, what data element are you collecting? As health, we're collecting for now the ages 10 to 14, 15 to 19 of deliveries. So we're looking at a total number of deliveries, and then we say, out of this total for this period, quarter or year or whatever, what proportion of them is 10 to 14 or 15 to 19? And then as such, that's the information that we've got data collection tools we report on our system. So so I wanted to explain why us as health, because health, I mean, remember the rape issue. As health, we are also need to ensure that we prevent. Remember, in our strat plan NSP, we should have 0 new infections of HIV by 2030. And if our 10 to 14 are getting pregnant, we are now saying we should look at issues of sexually transmitted infections and HIV. So then that also talks to the statistics for sexual offenses. The ones that come to the facilities, the ones that tested negative, and the ones that we put on treatment, because we are supposed to implement our universal test and treat policy. We get you positive now, we should initiate treatment promptly. So basically, that is what is talking to our statistics. Now, the 16 years, according to the sexual offense, a 16-year-old, you can't talk about consent in sex for a 16 and under. Now, our maternity guidelines have also been revised to be in line to say every 16 and under is identified as a high-risk client. And therefore, because of that, you must then see, you do all your history taking and whatever for the first visit. But part of what you should be doing as a clinician is to ensure that this particular child, this girl, young girl, 16 and under, is referred to a high-risk clinic. A high-risk clinic, by its name, you've got advanced midwives, you've got doctors, you've got all the, the multi-sectoral team that could be able to support this individual. In terms of the reporting and issues, I will request Mr. Mbangeleli, who is our legal advisor, to talk about the challenges with reporting and what we are doing, because we are doing something, and it's related to us when we confronted medical legal claims, and we had to empower our clinicians to be able to go to court and defend. So he will talk to us about that. There's an issue of how do we work health. Firstly, we Tutuzela centers. Let me start with those. They belong to NPA. However, NPA will approach health and social development, and they would then talk about because according to us and social development, we would appreciate if we could have Tutuzela centers everywhere.
But because of the resources, for now, we've got only 11. And when we start this program, as health, we should identify space in our hospitals, as you can see now in Makiwane. Secondly, we are also supposed to provide professionals, doctors and clinical forensic. There's Professor Aneidi, who will talk to issues of, there was a question which he's going to talk to. He's the internal head of the unit for Tutuzela, because this is clinical forensic. That's why he's here in Makiwane. And then we also provide resources in terms of the consumables. I indicated the refrigerators and the couches, the vaginal specula, and even ring fencing amount in terms of ensuring that there are comfort packs, there's debriefing, and then social development in the Tutuzela. It's a hot, as we know, it's a one-stop shop. So they do the counseling and so on. Now that is how, but I think for the Tutuzela, but in terms of how we're managing services on a day-to-day basis.
May I interject?
Okay.
We don't need
okay.
a representation because I don't know, may I hear what you are saying as you are representing. The most of the honorable members, there were questions, but most of the things there were comments. So now I'm worried that you are referring to other members that are still going to respond. Because of the time, we must be finished by 1. I think the Department of Health is going to consume the whole 30 minutes. So please don't give us a presentation again. With what are you doing? We've heard that. Now we just need the response for specific questions that we ask.
Okay, noted,
Thank you.
Honorable Chair. Then the Funda Friday, it's an online program with CPD points that is not only talking to issues of Form 22 or sexual offense, but addressing issues of maternal and child health, and including others, but with the revision of maternal guidelines that are talking to 16 years. And it is part of that every Friday. All the clinicians who can access, we sometimes get up to 300. So it's just online and it's an hour from 8 to 9. And it has actually helped us to reduce, we are seeing a very significant reduction for the first time in our maternal death. Q1, it was 90. Q2, it's sitting at 70. And our child mortality, when we looked at it, yeah. So can I just, sorry, ma'am, quickly, Honorable Chair, just give Mr. Mbangeleli just to. Okay.
Please, asithi qabu qabu. Okay. Because so that amanye ama-department azokhona kuresponda. That maternal death is still very high. It's extremely high. We appreciate kona lokuthi nenza lama post-mortem case study ukuthi what happened from the start to the end, but it's still high. We mustn't brag about it. I'm sorry.
Thank you, Honorable Member. Now, quickly, the issue that we are faced as a department is that of our officials who either due to their experience of being at court, then they get to be afraid of going back there. And I can actually imagine that it might be emanating from the ease of cross-examination. So some of them, they do not recover from the cross-examination. So basically, the department has managed to identify that problem and is dealing with it in terms of training them, guiding them as to how to deal with such matter. That does not necessarily relate on this topic of today. Talk of medical legal cases and any other matter, but it's a matter that is being addressed urgently. Thank you.
Thanks, Honorable Chair. I want to speak to issue around disability and data disaggregation. I think this is one of the lessons we are taking from here, because specifically when we manage the patient, we document the extent of disability within the form. But in terms of data collection, it hasn't really been the focus. But I think this is one of the key lessons we'll take forward and start looking at that in terms of gathering data. But around the issue of training, I think the point of doctors being scared to go to court, it actually emanated from the district surgeon who used to be the only doctor trained to manage these cases. Then it's invariably forensic nurses came into the picture, But now we're having challenges with forensic nurses, who are not, most of those who are trained are actually getting very old and retiring. And therefore, the responsibility is falling back on the doctors. Then there is a gap in terms of the training. And we've identified this. As part of the training in the department, all our interns are actually mandated to at least, witness and examine patients so that by the time they go for community service, wherever they are posted, they are able to actually examine these patients. And that's one of the key gaps because the skill in examining children's survival is actually a little bit more than examining adults. And that's one of the key challenges, which impacts on the fear to come, to appear in court. The other aspect is issue of gaps in terms of awareness at the community level, because even when mothers come with their underage kids to be examined, they equally don't see the value in the examination itself. It requires that the families will have to then be reconciled to be more of re-educating them on why they should accept to be examined. So these are some of the gaps, and I think as part of the strategies, community education is a critical thing that we need to be looking at, so that at least even mothers can actually bring the cases forward. Thank you.
Thank you, Chairperson. I'm responding on behalf of DSD. I've been asked by the DTG to just tackle 4 questions that were asked here for DSD's response. Hello? On the oh, thanks. Let me mandiye ngaphambi. Yeah, mandiye ngaphambili. If the first question, which was on Tutuzela, was seen as though the program at Tutuzela Center, honorable members, are not well coordinated or are fragmented. As social development, we have deployed about 22 social workers in the Tutuzela centers that are across all the provinces. They are all based in the hospitals of Department of Health. Of course, as it has been said by Health, they are led by the NPA. They are running a well-coordinated program. The only challenge I can put up, which has been when we visited with the MEC in Mthatha, for an example, hospital, the social workers that are employed by DSD can only work up until Friday from a Monday. Now, there was a query because the responsibility of social development there is the provision of psychosocial support services. The challenge was the fact that they are not available over a weekend, and some of the challenges are happening around that period. We are working on that to ensure that we stagger them so that they get available even over the weekends. So in other words, the program there is well coordinated. There is no doubt about that. The second question was on the strategy to combat gender-based violence. As a department, we have in place a national strategic plan on gender-based violence and femicide, which is a 2020 to 2030 plan. And in that, we have a specific focus on Pillar 4, which we're leading as a Department of Social Development. That is almost ensuring that there is clear support services provided within the areas that have to do with gender-based violence and femicide. Secondly, there's also what we call victim support services policy that is in place, which guides how these must be supported, how the victims must be supported by all entities that are in that particular sector. Included there is the fact that we also implement Pillar 2, which talks about 365 days action plan on gender-based violence, on integrated prevention programs specifically. So those are amongst the services that we render to combat gender-based violence. As I indicated also, we have extended services through funding. Organizations like NPOs, Makiwane is one of them, who just presented here. There's about 161 of those organizations that are funded by the department. They are supported fully by the department, not just two. I do note the fact that the remuneration of social workers
in the entities, funded entities, as opposed to those that are funded by, that are in the department. The discrepancy is a 75%. The funding that you give also incorporates 75% of salary. The other 25%, there's an expectation that the funded NPOs must fundraise. This is historical, dating even prior 1994. That is the scenario. In other words, a social worker that is within the Department of Social Development currently does not earn the same salary as that one that is funded, because the NPO is expected to do their own fundraising. Farida from Makiwane indicated that they are providing top up. They're saying partially, but they are providing top up of mere 25% that is outstanding. The other point, of course, is the fact that we have got a GBVF focused social workers in all the districts that deal, in other words, gender-based violence is a focused priority in the department, such that there are social workers that are focusing on that in all the offices of social work all across the districts. There's also the provision of sheltering services to victims of crime and violence. There was another question, if I don't want to take a lot of time, on the safety homes. As a department, we have never closed any safety home, not unless that safety home is not complying with the norms and standards. We have never, not at least in this province. That one I can say, and it's stand on top of any roof and say that. What is happening in a safety home is that all victims of gender-based violence, including victims of trafficking in person, from day one, they get admitted there. It can take up to 6 months. Sometimes it's extended, depending on the challenges that are still there, if there's a need to still accommodate them. That's what is happening there. In other words, it is regulated. A safety home is also regulated in line with the integrated shelter strategy, which looks on the compliance with its VEP norms and minimum standards. These are like safety and security, ensuring that there are registers in place, there's quality program that's rendered, there's services that are rendered of quality, which are monitored by social workers within the department. Also, the provision of psychosocial support services as guided by some of the departmental officials, skills development, reintegration and reunification, even after care services. I guess the only other point was the last one. What are the mechanisms that are in place to capacitate the funded NPOs? Of course, the NPOs, they differ. There are different categories. There are those that are well established, like Makiwane, which Farida was presenting on behalf of. There are others that are not really so much well established and capacitated. What we do there, every financial year, every single financial year, we conduct roadshows to all the districts and all those NGOs, even those that are not funded by the department, to ensure that they are capacitated on the concepts of the VEP concepts, inclusive of the legislation, strategies, and policy frameworks, exactly as I indicated. Clear pre-implementation workshops that are in place to look at good governance, financial management issues, all those areas, monitoring aspects. I think that is about it. Thank you very much.
Thank you. We have lost the other moving mic. If it can go, oh, it's there. The Department of Education, you can get it. I saw the MEC for Health, but I think she stepped out. We want to acknowledge her. I believe it's the MEC Tapa. Okay, if we have 2 minutes, she will greet. Come again. Oh, okay. Let education respond to the questions. Thank you.
Mr. Pat, you must follow me because I will take one, you'll take others. Okay. No, thank you. No, thank you, Honorable Chair and all members. Good afternoon. There's only one question that was posed to education, but I think we also need to explain what else are we doing. That's why Mr. Pata is here, who is heading inclusive education. I'm just going to touch on the issue of precautionary suspension and people that are jailed and so on. You must remember that precautionary suspension is meant to give space for investigations not to be jeopardized or interfered with. And precautionary suspension in the public service has got a prescribed period by which you must have had the testimony hearing. If not, it lapses, the precautionary suspension. But if it has to be extended, it must be through a formal process of applying to the chairperson of the testimony hearing and so on. But be that as it may, I think that's not our worry, including those that are in jail, like those that are in jail in any way. I think what the Honorable MEC was saying was that, look, in as much as she's in jail, it's fine for us because we don't have to worry much about the precautionary suspension. But what we are doing, we are looking at two possibilities for somebody who is incarcerated. One of those is whether we cannot invoke provisions around incapacity due to impossibility. The incapacity due to impossibility would be that you are incarcerated, you are unable to honor your employment contract, and therefore let's talk termination of that contract. That's one option open to us. And the other one, of course, is to monitor your appearances applying for bail, so that by the time you get bail, we also serve you with a precautionary suspension. So we look at all of those options. Now, I don't want to discuss a case of an individual. What I'm trying to say, as we approach the lady that is so famous, by being a Christian and all that culture, together with all the evil, alleged evil deeds, we're also exploring all of those. But one thing that we can assure you, there's no way in which she can come back and have contact with our learners without us having done the right thing. Obviously, the right thing is going to be done as we continue to do so with others. I felt let me just leave it there for precautionary suspension. But I think, Mr. Pata, just in 2 minutes, Honorable Chair.
1 minute.
Oh, one, it's fine. 1 minute, Pata, get to it.
So, Honorable Chairperson, thank you for the opportunity in 1 minute. I think what's important is the data management system. I think colleagues have spoken about how do we integrate data. Data is very important for education. We need to know immediately where's a child abuse. Is all our directors aware of it so that we can work together and respond immediately? So we've developed a data management system for education. But what we are saying, we want to integrate that system with social development, SAPS, and health. So there is synergy between the reporting of cases. We make sure that we support our children. Then on instruction of our MEC and our head of the department, we, in the beginning of the year, developed a child abuse guidelines, a very thick document that talks about all types of abuse. And we're currently busy training as we speak. The training is going on, ma'am. And it's very clear to what is expected from our teachers, what is expected from our social workers, our psychologists, and it's a very comprehensive training manual. What we're proposing is that we hold hands with other departments so that when we go further with the training, social development comes in on their part, health comes in on their part. We give a comprehensive training to our district-based support teams and our teachers. Other things that we are planning is the Indaba. So take note from the 11, 12, we have a very extensive Indaba on inclusive education. And with the prevalence of what's going on with the sexual abuse, what we've done, we've added to the Indaba. All our stakeholders will be there, chairperson, our disability sector, our unions, all relevant stakeholders. SAPS will be there, health will be there, social development will be there. And we have a specific stream that we've developed where these departments will now come together and come up with a proper action plan for the Eastern Cape Department of Education. I have many more to say, but my 1 minute is up. Thank you, ma'am.
Thank you. I just wanted to hear that give the mic to him. I just wanted to hear that who's going to initiate the coming together of all the stakeholders, but you have mentioned it at the end because you first said you propose for who, then you said we will have. That is much appreciated. Thank you. Honorable MEC, you were recognized in absentia. If we have time after the NPA, we'll just greet. We want to hear your voice. Thank you. 2 minutes.
Thank you, Chair. I just wanted to deal probably with this issue of the granting of bail to accused. However, my colleagues, I understand that they are better placed to deal with this, but I just want to share a little knowledge, at least from previous experience, that the magistrates, which are the costs of a first instance, where these accused go and appear at the creature of statute, they apply the law as developed and enacted by the parliament. To that extent, the right to bail is rooted in the constitution. That is constitutional right of everyone. Secondly, there is a primary legislation governing bail in South Africa. That is the Criminal Procedure Act 51 of 1977. That particular piece of legislation outlines the different types of bail. Section 59 thereof deals with the police bail, which must be done within 48 hours. Section 59, capital A, it deals with the bail by a prosecutor. And Section 60 thereof deals with a bail by a courts. The point I'm trying to arrive at here is that all these sections establish factors that courts must consider when deciding whether or not to grant the bail. There is even judicial precedence to this. You can peruse the case of S versus Dlamini, S versus Vermanas, S versus Weber. If then the parliament believes that the purpose for which these provisions were enacted for have been achieved, then it might be then we open up a discussion as to say that we need to relook now as to when should we consider to grant someone a bail or not. Otherwise, this outcry we have, we're still going to continue to have it because there is a pieces of legislation that dictates on how magistrates should actually adjudicate the issues of bail. I just wanted to actually iron out that particular point. Thank you.
Thank you, Chair. Let me stand up. Greetings to you and the entire entourage and the members of the parliament. My name is Ndandokazi Chapha, responsible for health in the province. I apologize for arriving late, but I had a commitment that it was beyond my control to reschedule. So I had to, but the team was here and I believe that they represented us very well. But I just want to say one point that as we navigate around the challenges as legislatures and community, but that element of the society we must really deal with it. It does pose a challenge for us as a Department of Health. I'll just cite one point. There is an instance where a teenager wants to get reproductive health assistance from us as a department. Once you begin to start ensuing on that process, the stereotypes kicks in, especially from the parents. One, you are encouraging my child to get involved sexually. Two, there are stereotypes that because we've got different reproductive system that we use. One, we can say you can have an implant on that lasts for 5 years. And they come and tell you that the thing that we are putting on my child in the arm is going to make my child not to have kids when you want to have kids. So I'm trying to say those are the stereotypes that are emanating from the society. I've been in instances where you do an outreach, but when you get there are children that are coming back to say, I want to remove this thing that is in my arm because my mother has told me that this thing is not right. I'm therefore saying community education is very important. And even on the issue of the statutory rape, community engagement is very important because there are instances where I will cite an example because gender-based violence is very rife in the province. Somewhere in Flagstaff, where I come from, there's someone who's working at the magistrate court who raped a boy child.
And this thing was discussed by the family and it was just left like that. And then he raped the second one. It is only now that he was arrested and it's a case, because at the first instance, it was dealt with by the family. That's the second child could have been prevented if the first one was dealt with. I am therefore saying the element of the society we must never leave outside. As long as we do not deal with the issue of the moral fiber of the society, we'll be faced with these challenges. As Department of Health will also say, as you appropriate the bill in terms of finances, take into consideration of the issues that you've challenged. The money that we get it from you. You pass the budget in national, you give it to us and we say thank you. As you talk about the issues of finances and all of that, as you appropriate, take into consideration those challenges that you find when you do on the ground. Thank you very much.
Thank you, MEC. Hey, Mqwabele, MEC wakho uzakugxotha. Uboqhwaba nje sisungasabi. Thank you, MEC. You see, it was important to be khona apha. I hear MEC uyangihlukumeza manje. Okay, because kune NGO, I think A1, we're not giving them space to respond because for them there were no questions. But kunale abafuna kuyi-raise, which is burning for them. Got that before they do you want them to start before? Which NGO, because it's only one and we're giving 2 minutes, not another presentation. I got a paper here on the table that there's an NGO that wants to talk to something that is very from the responses that were given here. No, AMA salaries, it was at the DSD talked on it, but we will interrogate it further, not here. Just respond to what you wanted to. But I'm giving you 2 minutes, please.
Thank you. Thank you so much, Chairperson. Good afternoon once again. I think I have the collective agreement that I'll speak. Yes, in terms of the salaries in the NGO sector, it is extremely low compared to what government is paying social work. In fact, professionals who are in the occupational specific dispensation, that is social workers, social auxiliary workers. And it's not because NGOs don't want to pay at that level. It's because of the lack of funding, and you are forced to do certain jobs, or you have to get jobs done within the communities, and you have as many social workers as possible. I mean, amongst us as NGOs here, there's disparity as well. But I can tell you that for the output that you're getting from the NGO sector, people are really very poorly paid. Thank you. We can engage on the levels later.
Thank you, Chairperson. Thank you for all the comments. This is a layer social workers, because we need the support as you appropriate bills and budget. Is in Cape gender-based violence on the rise, and for us, we took a decision of taking them to university. We give them bursaries, but the numbers were over for us to absorb them all. It means that the slice of any sneaker sona iyawuphelela kwi-COEs rather than omunye umsebenzi. We have to stop absorbing them. Siyabadinga ngoku because the gender-based violence is on the rise. Sidinga aba besibafundisile ngokwethu singurhulumente sibaqeshe, but the budget ayivumi. I am fighting with Minister of Finance each and every night about this. So we really need your assistance. Yoba xa kubudgetwa i-social workers as uba kuyabonakala yona ba immoral decay is nayo isengxakini as leaders ze-communities. Ithetha ukuthi kubi pha emakhaya. Siphuma ku-communities. kureyitshwa phaa kwi-community zethu kufuneka ii-social workers. So siyayicela leyo uba siyalwa nathi kodwa siyayicenga uba nani sincediseni into yoba ziqeshwe ii-social workers zikhona. Ndithetha ngoku ngabasifundiswe esithi bakhona abazali abazifundiseleyo abantwana babo nabo bazi-social workers nabo ba-in the basket, they need work. So I'm saying asikhali kodwa sidinga ukuncediswa because uba singabaqesha bonke thetha ukuthi angeke senze nto, thetha ukuthi singabe ne-COE qha budget, singamnanto kwenza nto ngenye. Bazawuthini? They need working tools, they need imoto zokuthini. And also the crime. Alfredo, sithathele 5 cars. Abasebenzi bethu besendimeni beyosebenza, bathathele imoto zabo, bathathele working tools, bathathele nezabo izinto personal. So i-duty yethu ke sonke as members of parliament province national ukuba siyilwe lo mikhuba kodwa sincediseni. Ibudget yona siyafuna noma niyalwa nathi kodwa siyafuna ukuncediswa nini ba pha Minister of Finance makasinike imali yokuqesha i-social workers. Thank you.
Thank you, Chair. It's my duty to wind up. Would like to thank all of you for the presentations that you've made, and just to understand that the comments that were made were not personal. Some of them may have come out as of a personal nature, but they are not personal. I'm from Gauteng, MEC, and in Gauteng, when we give health money, they buy skinny jeans and Lamborghinis. So we cannot just talk about the issue of resources without addressing the issue of corruption and resources being used for purposes they are not meant for, because we've got to work together. The second issue that's a challenge is that we spend more money in air-conditioned offices and administration than we spend on the cold face with the communities. And we don't have endless pots of money. It is incumbent upon management to create mean, efficient management structures so that most of the money should go to where it is intended to, for frontline services. I mean, I've been in healthcare all my life, and I see offices getting bigger. You go into newer hospitals, the administration block is better at Princess Mshieni than the wards. So those are the issues that all of us should be mindful of. And we have to work together. Money is not a bottomless pit. And your task is to ensure that people that are frontline have an enabling working environment. You know, when you say they work 5 days, they don't work weekends. They are humans too. They are paid for 5 days. So you need to get more than spread the 5 days that they could be off 2 days in a week, once a month to cover on those things. But we need to ensure that as we lead, we protect those that are frontline workers. We do not feed them to the wolves. The other issue will be left for the afternoon session, because we're not talking about what happens in communities. And until we address what happens in the home, what happens in communities, we will never get on top of this problem. And hopefully, as we engage with traditional leaders this afternoon, we'll get into the discussion. But for me, it's to thank all of you and to say, this is not the end, this is the beginning. And we will be back.
Okay, I know my co-chair has wrapped up, but I am told I'm doing my announcement. There is lunch for our stakeholders. Honorable members, we're moving to the Zela. Yes, Anidli, nizosebenza. So all the stakeholders, the lunch will be served here. We really appreciate.
Megan wants to just quickly ask something quickly. Sorry. But be very quick, Megan. We're out of time.
Sorry. Can I just please get your attention? I just want to quickly ask, because we've got the MEC of Social Development and the MEC of Education here, there is a serious case of learners who are blind and deaf who have been protesting this weekend. School has been burning, and this is due to a result of inefficient workers that are being allocated, but also there's cases of statutory rape that has taken place. Can the MECs please give us a report on how they've intervened in this? And I think this is quite relevant to what we are doing. It cannot be that we've got learners with special needs that are being sexually abused and we do not know what is the intervention.
MECs, we're going to ask you for a written response, if you don't mind, because we're out of time. But just to thank my two co-chairpersons, thank you very much for the MECs for being part of this discussion today. We are now going to the TCC, and from there we're going to the Premier Hotel with our stakeholders for the engagement with the traditional leaders and the Commission for Gender Equality. Those who are going with us will have lunch with us there. Our other stakeholders can help themselves to lunch on the left. Thank you.